Hello guys, this is Dr. Shahid and MD PG INI-CET, MD Radio Diagnosis. Today we are going to discuss our GT17. Let us review it and hope you will like it. So let's guys start with the first question. A woman come to the obstetrics OPD with history of 3 months amenorrhea. Her UPT is positive. She is known case of rheumatoid arthritis. She is a known case of rheumatoid arthritis and is on regular treatment of methotrexate. Which of the following fetal anomalies should she be consolidated before the pregnancy? Known case of rheumatoid arthritis, patient is on methotrexate. That means we have to look about the side effects of the methotrexate. So we should know what are the side effects of the methotrexate for pregnancy, so that we should counsel her about that. We know guys that acute Lesch-Nyhan syndrome, it is caused by penicillamine. It's caused by penicillamine. Epilepsy acute is caused by beta carbimazole or methimazole. Chondrodysplasia and chondrosyntosis. These are the two similar terms. You should be well aware about these terms because these are the terms maximum times we got wrong. Syntosis is caused by the methotrexate and dysplasia is caused by warfarin. That means our answer will be the methotrexate. Question number 2. A stool sample from a patient with an acute diarrhea is cultured on a medium that shows pale, colorless colonies. The microbiologist suspects a non-lactose fermenting gram-negative bacillus. Which culture medium was likely used? Guys, listen to me carefully. The question says the microbiologist suspects non-lactose fermenting gram-negative bacillus. It is giving us a hint that it is a non-lactose fermenting gram-negative bacillus. So we will use a medium which will help us differentiating among the gram-negative bacillus, which is lactose fermenting and which is non-lactose fermenting. Because it has already narrowed down our diagnosis from gram-negative versus gram-positive. We are not taking about the gram-positive because question says gram-negative. Now, among the gram-negative, we will be showing about which are bacillus, among the bacillus, which are gram-negative or which are gram-positive. Which culture media differentiates, among the bacillus, among the gram-negative bacillus, which are lactose fermenting versus non-lactose fermenting. We will use a differentiating media. Which among the following, which is differentiating media, beta? Which culture media was most likely? Means which is differentiating media? Blood agar? No. It is an enriched media. And it is used in to check the hemolysis pattern. Alpha hemolysis, beta, partial, complete hemolysis, beta. So, blood agar is an enriched medium. It is not a differentiated media. Second, chocolate agar, again an enrichment medium. It is used in Haemophilus influenza and mostly it is used in Haemophilus influenza. STA beta, STA is used in fungus. That means this option is gone. Chocolate and blood agar, these two options are gone because these are enriched media. This is used in fungi. The last option, which is a McConkey agar, so this is the only option which is differentiating media between lactose fermenting versus non-lactose fermenting. So you will remember this. There are two which differentiates lactose from non-lactose fermenting. One is McConkey's, in which lactose fermenting will appear pink, and CL-clad medium is another medium which differentiates lactose fermenters versus non-lactose fermenters. This CLED-clad medium, it is a general medium which differentiates all gram-positive, gram-negative, candida species of lactose fermenting versus non-lactose fermenting. However, this Macon case is selective for low selective for gram-negative bacteria. I'm again repeating this beta. Macon case among gram-negative bacteria, it will differentiate them. It will divide them among gram-negatives, which is lactose fermenting and which is non-lactose fermenting bacteria. Hope you understand this. Now the question number 3. Female patient comes with complaints of a wound and a joint pain. NSIDs were prescribed. After a few days, she presents again complaining of itchy vesiculoblast lesions, healing to give a brownish discoloration over the face. As shown in the figure, a fixed drug eruption is suspect. Diagnosis already made. It is a fixed drug eruption. Diagnosis given, guys. Now we will see what question is asked. All the following measures would be valid steps to treat, except that is why whenever I use it to give GT in the real examiners, I always try to read the last line because there is a twist. It is saying which are the which among the following are used for the treatment, except, for example, this reaction occurs because of NSAIDs. So we will stop the NSAID, of course, because it is because of NSAIDs. So we will stop them. Now, can we start antihistamines? Yes, because they will give a symptomatic relief. Because this causes the pruritus. The drug reaction causes the pruritus. It causes inflammation. So this can be used. Start topical corticosteroids. Can we start topical steroids? Yes, because it is an inflammatory reaction. Drug-induced reaction is an inflammatory reaction. So steroids are used in the inflammation. We can use it. So बचा कौन last में? Can we start systemic cyclosporin? It is an immunosuppressant. Can we use immunosuppressant? No, because we need immunity here. Why can't we use it? This is a simple question. Now again, this question number 4. Ransoft sign is seen in, but it is a factual question. Either you know or you don't know. What are the sign is seen in acute appendicitis? I will say beta. Around sign. There are Bachelor sign. McBurney point tenderness, that all you know. But I am telling about this. But there are Aron sign. This is used in acute appendicitis, and Bachelor sign is used in chronic appendicitis. There is another sign that's known as a 10 Horan sign that is used in also acute appendicitis. What about the ruptured CBD? The ruptured CBD is beta the Ransoft sign. What does this Ransoft sign mean? It is actual beta the yellowish discoloration around, if this is an umbilicus, if there is a yellowish discoloration around this beta, this yellowish discoloration around umbilicus, that is known as the Ransoft sign. So hiatus hernia, there is nothing the specific sign we can use. The mediastinal emphasis, there is this black shadow in X-ray, but the specific signs which are used, these are in acute appendicitis. This is not specific, the common sinus, the named sinus, Aron sinus, Bachelor sinus, 10 Horan sinus. Please try to remember these 3 for the acute appendicitis. For rupture CBD, it's Ransoft sign. What does this mean? It's a yellowish discoloration around the umbilicus. Now, the patient presents with a recurrent episodes of headache, palpitation, sweating. Headache, palpitation, and sweating. My diagnosis is done. Headache, it's a triad. Triad, headache, palpitation, sweating, along with hypertension is seen in this Pheochromocytoma. Now, 24 hour urine catecholamine and methamphetamine are markedly elevated. These are elevated. That means my diagnosis is confirmed. It's a Pheochromocytoma, which is following the most appropriate pre-operative management. But hypertension है इसमें याद रखना बेटा. Alpha receptors and the beta receptors. Yeah. Alpha, they cause vasoconstrictions mostly. That means they cause increase in BP. Beta, they will decrease the BP. Now, initiate, what is the most appropriate preoperative? Preoperative management, what is an appropriate? Initiate alpha blockers alone. Is it true? Maybe. Let us see. Initiate beta adrenergic blockers followed by alpha adrenergic blockers if required. Beta, think about it. If we block the beta blockers, then bacha kaun? There are alpha blockers, and these alpha blockers, their activity will increase because beta is not there. The drug available, the catecholamines available will act on alpha, alpha, alpha. That means our BP will shoot high, high, high. That means this is totally wrong. Initiate alpha adrenergic blockade followed by beta blockade if required. Makes sense also. Initiate beta adrenergic blockade alone. Nope. This will again cause problem. This will cause problem. Now among these, initiate alpha adrenergic blockade alone सिर्फ alpha blocker देना और initiate पहले alpha then beta. Among the two, beta A versus C, which one of this correct? Listen to me carefully. If we block alpha alone, beta, the beta is available. The catecholamines will act on the beta. Catecholamines may act on the beta. If we block beta alpha, there occurs a reflex tachycardia. So that means this is an issue. If we block the alpha blockers, there occurs a reflex tachycardia. That is an issue. So what we will do, beta? We will first block the alpha blockers, then do the beta blockers. First, the best. This is an PYT. Always this has been asked multiple times. First, in this Pheochromocytoma, first alpha blocker, then beta blocker. Both are given. First alpha, then beta blocker. Question number 6. Which a 5-year-old boy has a history of biting his nail? But this is a characteristic. Whenever you see a biting his fingers and the lips, always think about Lesch-Nyhan syndrome. It's always think about Nyhan syndrome. Always think about this. Has been diagnosed with HGPRT deficiency. HGPRT deficiency. What is an unlikely feature? What is an unlikely feature to be seen in this patient? Elevated urinaric acid creatine, basal ganglia involvement, developmental delays, decreased purine synthesis. Now we will see better what this HGPRT actually do. Then we will be able to answer this question. It will cause purine, HGPRT, and it causes them their breakdown. It causes breakdown of the purines. For example, hypoxanthine is converted into IMP. Now, if this enzyme is deficient, what will happen? The purine concentration will increase because purines are not being broken down. So, decreased purine synthesis or there will be increased purine synthesis. So, answer will be the increase in purine synthesis. By just knowing of one line, it HGPRT helps us in breakdown of the purines. So there will be an increased purine synthesis. Now the other features, yes, it helps us in because of purine our production. There is an increase in uric acid and increase in uric acid excretion. Increase in purine increases uric acid, and there is a basal ganglion involvement also in this patient. And when basal ganglion is also in the brain is also involvement, there may be, of course, development delays. No need to know all the other options. Just by knowing, if you know the concept, you can directly jump to the answer. Question number 7. A 26-year-old female patient on oral contraceptive presented with an abdominal pain, an increase in abdominal growth for few years. Physical examination reveals hepatomegaly and ascites. Liver biopsy shows severe centrotubular congestion, necrosis, and organized thrombi. But there isn't thrombi. Question is directly given. There is a thrombi in the major hepatic veins. Which are the following is the most likely diagnosis? Direct diagnosis. No need to know other lines. Just look at the last line. Thrombi in the major hepatic vein is it then Budd-Chiari syndrome? No need to know. There is no metastasis. Primary biliary cholangitis, secondary biliary cholangitis. Then there must be some fluoride duct reactions, because biopsy shows centrotubular congestion and primary biliary beta. Primary biliary में क्या होता था? There is a characteristic of fluoride duct reaction. Always ये दिया होगा. And what about this primary sclerosing cholangitis, PSC, primary sclerosing cholangitis, and primary biliary this cholangitis? These are two differentials, close differentials. जिसमें होता है बेटा onion skin fibrosis, and इसमें होता है fluoride duct reaction. How I use to remember this बेटा? PBC and PSC याद रखना बेटा. B means baby. बेटा बहुत फ्लोरिड होता है. ये फ्लोरिड डक्ट ये कुछ तूफान लाता है बेटा. इट्स लाइक अ फ्लोरिड, फूल जाता है. It causes the anger. Baby has an anger that's called a fluoride ductal lesions beta. That is why how I remember this PBC versus PSC. Match the JVP tracing with the conditions. Important, but the most important. There are two ways to remember. Either you just mug up किस JVP में किस condition में कौन सा graph आता है, or you know the concepts. Now, if we look at the JVP beta, this is a normal JVP. Now, by knowing the concepts behind the JVP names, you can directly come to answer just by marking up these graphs. But this is the whole phenomena is of right atrium. Whole phenomena is occurring in the right atrium. Now, how? Whenever this right atrium contracts, beta, the pressure increases. Or when there occurs a filling, when ventriculus, this right atrium gets filled, of course, the pressure will also increase. When it empties, the pressure will decrease. So that is the case. This is a JVP form. Whenever this atrium contracts, this is an pressure, atrial pressure, and it forms an A wave beta. This is an atrial contraction. And after contraction, it will of course relax. Atrium will relax. Whenever this relaxes, the pressure will down. Once atrium relaxes, it tries to relax. Of course, the ventriculus, the tricuspid valve between atrium and ventricle, it closes. When it closes, the tricuspid bulge, if this is an atrium, if this is a ventricle, these are the tricuspids. Once this closes, these closes like this, and they cause a slight elevation of the pressure in the right atrium. Then it occurs this like a C wave. This is a C wave. This is normally an ACUS. This whole is ACUS. in the X there is an elevation. This is a C wave. It is caused by this tricuspid bulge. Now, when its atrium relaxes, means atrium is in a dash hole. Now, atrium, they get filled. Once they relax, that means they are in a mood to receive blood. Once they receive blood, beta, the pressure will again rise up. They give the V wave. And after the filling, there are a passive emptying of right atrium. And again, the pressure will decrease. There is a V and a Y wave. Two types of emptying occur in right atrium. One is by contraction, another is by passive emptying. So, what you have to remember, beta, tricuspid stenosis. The tricuspid stenosis, beta, okay, here's a graph. Imagine the following. 1, 2, 3, and 4. These are the 4 graphs. These are given. Now we have to mark the answer. The 1. What does this 1 show? Here the A wave. Normally, what is A wave, beta? How was our A wave? If we look carefully, how is our A wave? This is our A wave. And in this graph, what has happened to the A wave? It has become a tall, canal-like A waves. And tall, canal-like A waves is seen in it is seen in AV block. AV block. Because atrium contract, the contraction, the flow is not going downwards towards the ventricle because there is an AV block. So the tall canal A waves are seen in the AV block. What does it do? Do you find any A wave? Here, beta, normally A wave ऐसी थी. In this 2, graph number 2, do we find any A wave? Or there is something, the rapid Y descent. Normally, beta, this is in V, and after V, this is in V, and after V, normally there is like this. It should be go like this. In a Y wave, should like this. But in this case, there is a rapid Y descent. There is a rapid Y descent. This rapid Y descent is better seen in this tricuspid regurgitation. And in image 4, you will see there is an absence of A wave. There is an absence of A wave, beta, because the mark is seen directly. This is in C wave. There is no A wave. And absence of A wave means atrium is not contracting. When atrium is not contracting, the condition is known as the atrial fibrillations. They are not properly contracting. They are not generating any pressure. That is why this graph belongs to atrial fibrillation. And option number 3, if we look at the option number 3, A wave is given, C wave is given, and X wave is given, then V wave is here, then where is the Y? We do not find any Y wave. We did not find any beta Y wave. The absence of Y wave is better seen in cardiac tamponade. It will take a long time because I don't have that much of time to explain you how this happens, because beta in cardiac tamponade it does not allow you your atrium and ventriculus to relax properly, because this Y wave occurs when ventriculus get passively emptied Because of external pressure, this does not allow this right atrium to empty passively into the right ventricle because there is an external pressure. These are causes that these are explanation. JVP, it took a long time to explain you, but what to remember from it, beta? I will tell you. Canon A waves are seen in AV block. Absent A wave is seen in AF, and there is a term I use taxi and a tax. What does this mean, taxi and tax? Beta, pericarditis. In constructive pericarditis, there is a prominent X and Y wave. Both are prominent. In cardiac tamponade, there is a prominent Y wave. Sorry, prominent X wave. X. In tamponade, T for tamponade, there is a prominent of X wave. I hope you remember. Taxi pericarditis में X and Y both are prominent, and tax tamponade में X is prominent. If X is prominent, that means there is an absent Y wave because I don't write Y here. In this connected to pericarditis, there are both X and Y. These are the prominent. Here, this is a pearl. What you can find, there is an X absent X descent. There is a tricuspid rapid X descent. There is a cardiac tamponade. Absent Y, again cardiac tamponade. That is what I have written, taxi and taxi. Question number 9, beta. Question number 9. An infant with a CTEV that is undergoing weekly Ponseti cause cavus, forefoot, addiction, and heel virus have been corrected. However, residual hindfoot equinus persists, which are the following best setup before final casting and bracing. Beta, CTEV, Clubfoot, also known as beta, Clubfoot. What's the treatment for this, beta? Because this is an infant, beta. For an infant, if we know the treatment for this for an infant is given is a weekly Ponseti's cost. And what is the sequence of this, beta? We use scale for this. There is a sequence of this. First, we try to correct the cavus, then we try to adduction, then we try to correct the varus, and at the last, we try to correct the equinus of this patient. How there we see beta cavus, adduction, and valgus has been corrected. Now the patient has a hindfoot equinus is in persistence. What does this equinus mean, beta? Equinus means beta there is an that problem is at anchor, and it is in plantar flexor. How we can correct this? देखो बेटा, suppose this is an beta tibia fibula, this is an ankle, and plantar flexion, this is our foot. This has gone like this. Normally, our foot should be like this, but this has gone like this because someone is pulling it downwards. Someone is pulling it downwards. Now, how we will correct this? We will try to release pressure on the back so that the opposing forces, the downwarding forces which are pulling this back, so that this can resist and it can come back to the normal. Or we can pull this up. Either we can nullify this, we can cancel this force, or we can increase dorsiflexion force. There are two ways. The best way is there is a tendon which causes this plantar flexion, that means which causes this downward force is Achilles tendon. Here you know the behind tendon, this is an Achilles tendon. And if we cut this tendon, the pressure will get released. That is why the next step before final casting will be to correct the equinus is the Achilles tenotomy. Again in the question beta, it shows infant. Suppose if we don't know the answer, how can we come to, if we know the concept, if we don't know the concept, how we should be able to answer this question? Beta, it is given here before 1 year beta, after 1 year, after 1 year beta, if deformity is corrected or this untreated previously, between 1 to 3 years, there is an posterior medial soft tissue release. But age is an infant. That means this will not be. Triple arthrodesis is usually done in after 10 years. This is also done. Tibialis anterior tendon is another option, but the best option is always actually this tendon tenotomy. Got it? Simple concept beta. Yeah, this is a normal foot. This is this foot. Clubfoot. This is an equinus. Now, someone has pulled this downwards. The force which has pulled this is in tendon, Achilles tendon, and we just want break down this force so that this can come back. That's it. Now, was brought to the ophthalmologist department. Reveals hearing loss, congenital head this defect, and the following lesion has been seen since birth. Ophthalmology department reveals hearing loss, this bilateral cataract beta, congenital heart defect, this congenital rubella, this rash, or congenital Rubella syndrome beta. Always, whenever you think effect, always think about this. If you see this kind of this with muscle rash, this effect, think about beta congenital Rubella syndrome. And there is a 2 points. But effect is you will always think about the 2 points: anterior uveitis and microphthalma, not megaophthalma. Always remember these 2 points. You try to trick you anterior versus posterior and micro versus megaophthalmus. It is always anterior versus and microphthalmus, not megaophthalmus. Question number 11 beta. This is an anatomy question beta. The given match the following to the medical origins imaging techniques used beta. T1 weighted, T2 weighted, STEER, and a FLAIR. How we will remember beta? T1 is anatomy. T2 beta is a little bit modification of this anatomy, and STEER and FLAIR I will see beta. T1 beta anatomy क्या होता है beta? Fluid beta, it will appear dark. Fat white होगा. याद रखना बेटा. T1 में anatomy जैसी होती है वैसे आता है. T1 will appear fluid and fat will appear white. In T2, what will happen? The fluid will appear white. Fat will also appear white. Remember man, T1 fluid dark आएगा, fluid dark आएगा. T2 में fluid dark नहीं आएगा, fluid भी white आएगा. T2 में दोनों white आते हैं. And in beta STEER, it is beta T2 minus fat. T2 minus fat क्या होता है बेटा? T2, it is like a T2. T2 में क्या है? Fluid white होगा. Fat क्या था? White, but it is minus fat. Fat का उल्टा. Fat will appear dark. I got it. Now the third is, the third part is, the fourth one is FLAIR. FLAIR is beta T2 minus fluid. T2 minus fluid. Fluid क्या था बेटा? Fluid T2 में क्या था? It was white. Now it will appear dark. But fat क्या था? Fat will appear white. It will remain like that. Simple. T1, T2. T2 याद रखो, दोनों white. Then T2 minus fat T2 minus fluid. T2 minus fluid is FLAIR minus fat is CTEV. That's it. अब बेटा कैसे दिखेंगे? देखो बेटा, देखो, this is बेटा, this white thing, this is fluid. जो बाहर है, this is also बेटा, this is in fat. Now, in this condition, both fluid as well as fat is white. Which will be the condition? It is T1, T2, FLAIR or CTEV. Look at that, T2. Fluid is white and fat is also white. So image 1, it will be beta. Image 1, it will be T2 weighted. So option C, it will be directly answer. There is only one option. T1 weighted CTEV, it will be answer. T1, that is option number 2. Image number 2 beta, देख लीजिए. Fluid is dark. Fluid is dark. And the fat is white. Fat is white. Which is condition? This is beta T1 weighted. Option number 3. 3 क्या था बेटा? Fluid white है. Fat black है. Fluid white. What is CTEV? CTEV is fluid white. And the fat will appear dark. Fat will appear dark. It is in CTEV. That means this is done. I hope you remember this question. How to solve this. A 50-year-old present with in a right breast. She was advised to undergo mammogram. The radiologist reports the mammogram. It is some Bacilli too, beta. What will be the management plan for this beta? Simple, सी बात है. You have to remember the Bacilli. There are 0, 1, 2, 3, 4, 5, 6. This is the Bacilli category. In Bacilli 0, what we have to do? Nothing. Additional, we need additional imaging. We need additional imaging. In Bacilli 1 and Bacilli 2, Bacilli 1 and 2, we need annual screen. Bacilli 3, we need 6 monthly mammogram. And Bacilli 4, we need a biopsy. And 6, 5 and 6, we need action and treatment. Remember, and 4, biopsy has to be taken. Bacilli 4, biopsy has to be taken. 1 and 2, animal screening, and 3, 6 months screening. This is the beta management plan for the Bacilli. One day, at 30, a patient with a keratoconjunctivitis has discomfort in a foreign body sensation. Slit lamp examination shows fine epithelial mucus strands attached to the cornea at one end, with one end freeze. बेटा cornea से attached है, एक end attached है, दूसरा end free है. The second end is free. देखा, this is an important point to remember. This is an corneal filament beta. Filaments, one side they are attached, and other side they are free. Try to remember better. One sided they are attached and other sided they are free. This is in filaments. What about the infectious crystalline keratopathy? The infectious keratopathy is actually, whenever you think branching opacities, there will be a branching opacity. There will be an infilament. One end will be free and one end will be moving. In this infectious crystalline, there will be a branching opacity. What about the band? There will be a band-like, simply band-like opacities. There will be a band-like opacities. And it's also a lipid keratopathy. Lipid keratopathy, you will be find a white or a yellow lipid deposits. There is always this confusion between two filaments. One end will be free and another end will be diffused with the cornea. And infectious crystalline keratopathy, there will be a branching capacities. I'm trying to read fast so that I can complete it at time. Again, this is the calculate the perinatal mortality rate of this patient beta. Perinatal mortality rate, you should know the formulas. Late fetal death and early fetal it includes the late fetal death, early neonatal that is weighing above 1,000 grams at birth. Remember beta, this total births divided by total births, this includes live births plus stillbirths weighing over 1,000 grams multiplied by 1,000 beta. Now, how we can late fetal death? What does mean late fetal death means? Late fetal death means it means the settle birth. And early neonatal means up to 7 days of life. But normally, and by definition, we calculate from 22 weeks. But for calculation, remember this better. By definition, we usually take it from 22 weeks. But for calculation, whenever the question comes, because at 22 weeks, there the baby is 500 grams only. So by this formula, we have to take the baby weighing more than 1000 grams. So beta, in calculation, we have to take 28 weeks, the cutoff. From 28 weeks up to 7 days of life. This is the beta perinatal mortality rate. Below 28 weeks, we are not calculating for this exam purpose. But by definition, if anyone tells you when this perinatal this period starts, you will always start from 22 weeks. But for calculation, it is for 28 weeks. It is simple, but calculation will be as simple as that. There are major fresh fetal births. The fetal births are 90, so we will go 90 plus early neonatal. In first 24 hours there are 20, and 2 days to 70 days there are 60s. That means we will go 20, 40. These are 60, 90 plus 60. Beta, these will be 150. Yeah? 150. How I calculate beta? Late fetal death means beta fetal birth is given is 90, so we will go 90. And early neonatal means beta up to 7 days of life. फ्रॉम बर्थ से लेके 7 दिन तक बेटा. बर्थ फर्स्ट 24 आवर्स का है, ये डे फर्स्ट है. डे 2 to 7 ये भी 40 डेज 40 गिवन है. दैट मींस इनको मुझे ऐड करना है ताकि इट विल कम फ्रॉम डे 1 to day 7. इज इट मेक दिस बिकम अ 60. सो वी न्यूमरेटर हमें आएगा बेटा, इट विल कम 90 plus 60. What does the denominator tell us? Total births. What is a live or non-live? Those 1000 above जितने भी है, that is given as 6000. It's 12 by 6000 into 1000. Calculating this, they will go on 150 divided by almost. It will be a 60. It will come around 25,000 births. This is simple mathematics, beta. A child presents with a delayed motor milestone, poor speech, persistent drooling, abnormal involuntary movements of the synostomy infancy, reveals intermittent abnormal posture. There is a history of severe neonatal joints in the first week of exposing trons. But neonatal joint is given here. Joints better given here. There is then delayed developmental stools है, milestones है, abnormal involuntary movements है baby का, intermittent abnormal posturing है, neonatal joints hit दिया गया है, there is a neonatal joints and brain defect. It's always connectures, and in connectures it affects the beta basal ganglia. This is how you will approach this question. Beta cerebellum होगा तो there will be loss of balance at all, and front cortex there will be a personality change, etc. But it is given a neonatal joint hint is given, that means it will always go at the basal ganglia. Which of the following anticancer drug is likely to cause the pulmonary fibrosis? But pulmonary fibrosis, it is important question. But for a mnemonic, I use it to remember that biliomycin man cannot breathe nicely. A biliomycin man cannot breathe nicely. A means beta amiodarone, biliomycin man, methotrexate, and mitomycin C cannot means beta cyclophosphamide. Breathe, it means this what's called as busulfan. Nicely means nitrofurantoin. These are the common drugs which cause fibrosis. Or you can find there must be always a this what's known as called a vehicle in name. For example, buses, Bolero is there, except this platin drug is better. Car platin, there is also called, but this is not a drug causing it. Except platinus, better. Platinus, they are not causing this fibrosis. Otherwise, you will find a vehicle in the name of drug is causing pulmonary fibrosis. Or you will try to remember a biliomycin man cannot breathe nicely. Uncomplicated internal hemorrhoid. It is an internal hemorrhoid, beta. Hemorrhoid is present with bleeding for rectum, but there was no absence of penis because the hemorrhoids are located. Internal hemorrhoid is beta above the dentate line. There is a dentate line, beta. It is a marker. Above it is an internal hemorrhoid. Below it is an external hemorrhoid. Externals are painful, beta. Externals are painful. Try to remember it like. Try to remember this like an examination, and finally your examination is done. Internals अपने होते हैं, they pass everyone. Externals सब डरते हैं because they come from the external. Externals are painful, बेटा याद रखना. F48 is brought to the emergency department 2 hours after an accident involving kerosene. बेटा उसने kerosene लिया है, kerosene ठीक है बेटा. He is hemodynamically stable currently. What's the most appropriate treatment for this patient? Because he has taken a kerosene. Kerosene क्या है बेटा? It is an बेटा kerosene accidentally इसने लिया है, ठीक. It's a volatile, highly volatile है बेटा, ठीक है. Can we do a gastric lavage immediately? No, because it will cause aspiration, because it is a volatile drug. So in gastric lavage there is no need to do gastric lavage. Can we administer activated charcoal? No, because it is polyabsorber. Neither do we have to do nothing in kerosene poisoning unless a patient is unstable. We have to do nothing बेटा. क्यों बेटा? ये बेटा absorb और easily wash out भी होता है, easily, because it is this is highly volatile drug बेटा. We have to do nothing with it. So administer no nothing. Whole bowel irrigation no nothing. जब तक हम polyethylene glycol slowly act तब तक वो wash out. Observe support to creatine monitor for years. We have to go just support to care in the kerosene and volatile substances. Nothing had to be done. ठीक है बेटा. 19 question number 19. With no history, there is clear cut. There is no history of smoking. Present is prognosis. Examination revealed breath sounds and mild joint. HRCT shows that diffuse emphysematous obstruction predominantly involving the lower lobes. Lung biopsy shows pause positive, diastase resistant cytoplasmic logs within the hepatocytes, which are of phonic expelling. Pause positive, diastase resistant. But सब कुछ दिया गया है. It is always an antitrypsin. Alpha 1 antitrypsin beta. It is beta alpha 1 antitrypsin beta deficiency. Pause positive diastase resistant is suggestive of alpha 1 antitrypsin deficiency. क्यों होगा बेटा? Alpha 1 antitrypsin क्या है बेटा? It normally checks the neutrophil elastase activity that causes destruction of the entire this. ऐसे नहीं बेटा. वहां पे बेटा क्या लंग्स में ये मान लो बेटा न्यूट्रोफिलिक elastase होता है. This elastase causes destruction of the SNI. This neutrophilic elastase causes destruction of the SNI, and this neutrophilic elastase is controlled by alpha 1 antitrypsin. Whenever alpha 1 antitrypsin deficiency occurs, this neutrophilic elastase activity increases. It causes destruction of the SNI. It leads to emphysema. So how this occurs? There occurs unopposed neutrophil elastase activity, because unopposed, there is no control point, there is no one is checking him, so he becomes a boss. Try to remember beta, this is occurring in non-smokers. Alpha 1 antitrypsin is occurring in a non-smoker. Emphysema beta, अगर मैं types की बात करूं बेटा, types of emphysema, there is an most common type beta. It is seen in smokers. Pan-SNR beta. It is seen in alpha 1 antitrypsin deficiency, and it is seen in non-smokers. याद रखना. And paraseptal beta ये youngs में होता है, youngs, and it is seen in spontaneous. याद रखना बेटा, spontaneous pneumothorax होता है paraseptal का. Point याद रखना बेटा. Central बेटा याद रखना, सेंट्रासिनार स्मोकर्स में होता है, पैनसिनार किन में होता है बेटा? एंड अल्फा 1 एंटीट्यूशन डेफिशिएंसी पैरासेप्टल यंग्स में होता है, और इनमें स्पॉन्टेनियस न्यूमोथोरैक्स का रिस्क रहता है. A psychotic patient develops a voluntary purposeless movement and was observed to be standing. याद रखना बेटा, इवन कोई ऑप्शन आएगा ना, it's standing still for hours. एक ही जगह बैठना बेटा for hours with wax flexibility and negativism. Which of the following is likely to worsen her condition? It is a beta catatonia disorder. Catatonic disorder. What does this catatonic disorder mean? Catatonic disorder बेटा एक behavior abnormalities होती है. Behavioral abnormality. जब भी बेटा आपको क्वेश्चन में देखोगे ना, patient has a behavioral abnormality. क्या क्या होगी इसमें बेटा? फॉर एग्जाम्पल इसमें बेटा इमोबिलिटी होगी. एक ही जगह बेटा पेशेंट खड़ा रहेगा, कंटिन्यूअसली खड़ा रहेगा. और एक्साइटमेंट, बहुत ज्यादा एक्साइटेड पेशेंट होगा बेटा. और इट विल कॉज अ मिमिक्री ऑफ स्पीच और मिमिक्री ऑफ एक्शंस और मूवमेंट्स. ये बेटा याद रखना भी इंपॉर्टेंट. कैटाटोनिया पेशेंट्स के लिए बेटा हिंट में दे रहा हूँ हाउ टू सॉल्व दिस क्वेश्चन. आई एम नॉट हियर टू एक्सप्लेन यू द टॉपिक, आई एम जस्ट टेलिंग यू एमसीक्यूज को कैसे बस थोड़ा सा सॉल्व कैसे करते हैं, कौन सी टिप हम यूज करते हैं. बिहेवियर मूवमेंट पेशेंट आएगा, एक ही जगह खड़ा या ज्यादा से एक्साइटमेंट होगा, मूवमेंट स्पीच रिपीट करेगा, mimicry of the speech will be there, or there will be a mimicry of the movements. Try to remember this point, mimicry. So it's always in catatonia. And the catatonic disorder बेटा, इसमें बेटा क्या होता है कि इस catatonic disorder ट्रीटमेंट बेटा इलेक्ट्रो ECT बेटा इनमें ट्रीटमेंट दिया जाता है बेटा. इट्स एन इफेक्टिव ट्रीटमेंट फॉर दिस बेटा. It's an effective treatment for this. And this catatonic disorder beta yaad rakhna, it can occur, it can be drug induced also. It can be beta drug induced also beta. This catatonic disorder is beta drug induced also. Which are the drugs? What are the drugs which cause this catatonia? Try to remember, so it will solve this whole this mystery. One thing you will remember, this mimicry, immobility, that is one thing. Other thing you will remember, the drugs which are causing this catatonia. One is corticosteroids, immunosuppressants, and antipsychotics. याद रखना बेटा. Corticosteroids and antipsychotics, these are the drugs which cause this, which increase the risk factor of this. Among these drugs beta, which among the following is antipsychotic beta? This is all, sorry, this olanzapine. Olanzapine is a beta antipsychotic, and antipsychotics are avoided in this catatonia. A psychotic patient develops one person and was observed standing. It's same question. Huh? This is same question beta. 21. Male significant history packs a smoker है बेटा with a chronic cough, unexplained weight loss, have worsening disability, centrally positioned hylar mass. एक तो hylar mass is identified, a lung biopsy person, microscopic which are the following clinical feature is likely to be associated paraneoplastic syndrome बेटा. आप बेटा एक तो हमें बायोप्सी दी गई, इमेज दी गई है, हमें इसको ये लंग मास है बेटा, हाइलर मास है, हमें बोलना है इस हाइलर मास के साथ कौन सा paraneoplastic, which paraneoplastic syndrome is associated with this condition. If we see beta, these are oval shaped, lot of oval shaped cells given here, everywhere. These are given all these oval shaped cells beta. What are these? Small cluster of round oval shaped cells with the data center में आप देखोगे there is a nuclear modeling. There is a nuclear modeling everywhere. There is a nuclear modeling beta. Nuclear modeling, small round cells with nuclear modeling beta. Can you see? This is a small cell lung carcinoma beta. Small round oval cells with nuclear modeling beta. It is seen in small cell lung cancer, given because patient has a weight loss, chronic cough. It is in weight loss, worsening is in hylar mass, lung mass है बेटा, lung mass with small round cell. This is known as a small cell carcinomas बेटा. In small cell carcinoma, what is an paraneoplastic syndrome beta? If we see that in small cell carcinoma, there is a paraneoplastic known as SIADH is seen in the small cell carcinomas beta. And in SIADH, there are hyponatremia and water retention. If we see I am not going to teach you SIADH again because you know that SIADH there occurs in hyponatremia. So it will be in hyponatremia. Kidney stones, bones, and abdominal pain. This is means that there is an hyperparathyroidism, and which tumor, which cancer, which stomach cancer, this lung cancer is associated with hyperparathyroidism, but it is squamous cell carcinoma. Squamous cell carcinoma. Ptosis with diplopia worsening during cell, but it means myasthenia gravis, of which lung cancer is associated with myasthenia gravis, but it is thymoma. And painful swelling around wrists with distal clubbing. Distal clubbing, it means better hypertrophic osteoarthropathy. Distal clubbing, hypertrophic osteoarthropathy. Hypertrophic osteoarthropathy. This is a peroneoplastic syndrome beta. It is commonly associated with adenocarcinoma, lung adenocarcinoma. Beta, how have we discussed it? 4 peroneoplastic syndromes. The small cell lung cancer beta that is associated with SIADH. Squamous cell cancer is associated with this hyperparathyroidism, and myasthenia gravis is associated with thymoma. Hypertrophic osteoarthropathy is associated with the adenocarcinomas. Question number 22 beta. Male present with paresthesia, gait instability, progressive fatigue, paresthesia beta, neural symptom beta, gait. This is an some neural involvement is there. If there is a megaloblastic anemia, he was found vitamin B12 therapy, and following this is neurological symptoms improved, but his anemia essentially showed only minimal involvement. What is the most likely biochemical reason? Beta पेशेंट्स को मेगालोब्लास्टिक एनीमिया था, हमने इसको B12 दिया. B12 के बाद इसके जो न्यूरोलॉजिकल सिम्टम्स है, द न्यूरोलॉजिकल सिम्टम्स गॉट इम्प्रूव्ड, बट anemia is not fully improved. What is the reason behind this beta? There is because it's always better whenever there is a B12 deficiency. This megaloblastic anemia B12 deficiency is always associated with folate deficiency. Megaloblastic anemia, two brothers, B12 and folate, they go hand in hand. Whenever you try to correct the B12, always do a folate again. This with it, I will explain what is the main reason behind it. Better this is the reaction better. This here and the B12 you will see there occurs a reaction occurs. The homocysteine is converted into, in the B12 beta, homocysteine is normally converted into the methionine. In the same reaction beta, the vitamin B12 is required. Again, this vitamin B12 in the same reaction, it is required for conversion of the 5-methyl tetrahydrofolate. 5-methyl tetrahydrofolate is converted into the tetrahydrofolate. This tetrahydrofolate, it becomes active. This tetrahydrofolate beta, this is an active form, and this active form beta. This active form will function and result in action. So if we trap folate here, methyl tetrahydrofolate is not converted into tetrahydrofolate. This folate gets trapped in methylation form, so it will not be available to function. So if we correct B12, because B12 deficiency causes neurological symptoms as well, but folate deficiency does not cause neurological symptoms, but folate deficiency causes anemia. So if we give B12 to this patient, if we give B12, B12, the neurological symptoms caused by B12 will be corrected, but the folate deficiency that is here will not be corrected. So the main problem is here, there will be a impaired conversion of this methyl tetrahydrofolate to tetrahydrofolate. This is a better main problem to this patient. This is a main issue in this patient better that we are. So question number 23 beta. You are an intern in the pre-eclampsia ward beta. You induce administration of magnesium sulfate injection to the patient. Which of the following is not mechanism of action of which is not magnesium sulfate? Which of the following is not the mechanism of action of this beta? One thing, It blocks NMDA receptor. Yes, it blocks. It increases the calcium buffering in mitochondria. Yes, it potentiates the action of this adenosine. Can it enhances this and palate sensitivity acetylcholine? No, because it is an beta. If it increases the acetylcholine activity, it acetylcholine increases the neuronal excitability beta. That is the thing we don't want, because in preeclampsia there will be a seizure. Also, if a patient goes into the eclampsia beta, patient will be experiencing the seizures beta. So it decreases the motor and sensitivity. It is a motor and palate sensitivity beta to acetylcholine. It does not increase. It decreases. Try to remember. It decreases. It is against acetylcholine. MgSO4, magnesium sulfate beta. It is against acetylcholine. Remember this point, beta. It is against the acetylcholine. So, beta, we will start the question number 24. 34-year-old woman with an 11 weeks of pregnancy is diagnosed with an invasive ductal carcinoma of the right upper corner of breast, beta breast cancer in pregnancy. Beta. What are the metastasis? Beta? What is the appropriate management? Beta? Delay all treatment until delivery. बेटा अगर पेट प्रेगनेंसी में ब्रेस्ट कैंसर है, क्या हम डिले कर सकते हैं? No, we cannot delay this patient because the progression, the progress वो बढ़ता जाएगा, and it will cause the problem because there will be a progression of the tumor. Can we do a modified radical mastectomy during pregnancy? Maybe. Let us see. Breast conservation surgery followed by radiotherapy. No, we cannot give a radiotherapy to the patient. So this option is gone because after BCR we have to give radiotherapy. So we cannot do radiotherapy in this pregnancy. Chemo, can we give a chemo? No, we cannot give a chemo to this patient because it will cause a birth defects. So what is the option left for us? We will do a modified radical mastectomy. We can go radical mastectomy in first and second trimester beta. If a pregnant lady has a breast tumor, we can go modify radical mastectomy in first and second trimester, and the late trimester we can go a lumpectomy. In the third trimester, if a patient comes in third trimester, we will do lumpectomy beta. In third trimester, we will do a lumpectomy. And after delivery, we can go for this radiotherapy. 25-year-old female with a chronic nail diastrophy present with greenish discoloration of the nail bed. जब भी greenish discoloration होगा बेटा, it is all you will always think about pseudomonas beta. Slight thickening, oncolysis. The sun has a dirty sweat color. Microscope reveals a gram-negative bacillus. Which of the following best characterizes the pigment-producing organism involved? Pigment-producing organism involving beta. It is beta. You will know Pseudomonas aeruginosa. It produces a blue pigment known as piocenin. Pseudomonas beta. Pseudomonas produce a blue pigment. This is known as a piocenin. What about the produce alpha hemolysis on blood agar? No, alpha hemolysis is produced by Streptococci viridis. Organism Pseudomonas. So this is not double zone hemolysis on blood agar, which causes double zone hemolysis. Double zone hemolysis caused by Clostridium perfringens. Double zone is caused by Clostridium perfringens. And black pigment on blood is caused by some fungi. A child in a small area is evaluated by pallor, fica, and gross retardation, stool examination, non-bile stained eggs. Non-bile stained, we usually remember them, NEEHA. Nectar americanus, Antirrhobium formicularis, and cyclostome. Okay, we already use them. What with a thin transparent containing blastomers. The blastomers is used in egg. Egg is first. It is a non-bile staining. Non-bile staining. It is, we will remember them, the NEEHA, Nectar americanus, Antirrhobium formicularis, Haemophilus nana, and Echinona, and cyclostoma duodenum. This is a non-bile stone. Among the non-bile stones, it shows the blastomers. The blastomers are seen in Nectar americanus and Cyclostoma duodenum. And these two belongs to hookworms. In the hookworms beta, which are the following represents infective stage beta. infective stage. For the hookworms, beta, there are falciform larva and rhabditiform larva. Falciform larva, it is a beta infective stage of this patient, and rhabditive is seen in the stool. It can be a diagnostic stage of this patient, beta. Okay, beta. I hope this explains the infective stage is beta falciform larva. We're talking about this eggs beta. The embryonated eggs, it is seen in beta. This is an infective stage of helminthus and Ascaris at all. And metacercary beta. Metacercary is seen in the trematodes. 19-year-old female presents with unilateral nasal obstruction. Oh, good question. Unilateral nasal obstruction. 19 years adults. Abstract is anosmia for 4 months. There is an anosmia for 4 months, beta. Nasal biopsy reveals a febrile mass arising from the roof of the cribiform palate. Roof mass arising from the roof of the palate. याद रखना बेटा points. MRI shows extension into the anterior cranium. Demonstrate a small round blue cells arranged in a rosette, which are the following the most likely. Can it be a juvenile nasopharyngeal angiofibroma? Can it be? Nope. Nope. Because that will arise from, it arises from, it arises from, the given question, it arises from the roof of the pen. But juvenile nasopharyngeal angiofibroma arises from suphenopalatine foramen. It arises from the suphenopalatine foramen. Inverted papilloma, it arises from the lateral wall of the nose. Lateral wall of nose. And nasopharyngeal carcinoma, this arises from the nasopharynx. Commonly in host of Rosenmillers. Oh, beta, olfactory neuroblastoma, also known as beta olfactory neuroblastoma. It's also called as asthenoneuroblastoma. Asthenoneuroblastoma, beta, it arises from the roof of this nasal cavity. But juvenile arises from suphenopalatine foramen, inverted papilloma, lateral wall of the nose. Olfactory neuroblastoma arises from the roof of the nasal cavity, nasopharyngeal from the Rosenmiller fossa. X-ray shows this. A patient with history of asthma presents with a certain breathlessness. On examination, there is a slight decrease in breath sounds. Okay, breath sound is decreased. Right up. X-ray showed us pneumothorax, bronchial asthma, and a pneumothorax. What is the next best step? Question is a pneumothorax. Whether it is a primary or secondary pneumothorax. But primary pneumothorax is better. This is there are two types of pneumothorax. One is better primary pneumothorax, and secondary second one is the secondary pneumothorax. The secondary pneumothorax occurs those who have an underlying lung disease. For example, this patient has a bronchial asthma, and this there occurs a subpleural bulbous they rupture, they cause the bronchial asthma. What is the management of this data? What is the management for this patient? The management for the patient are primary pneumothorax versus secondary pneumothorax. If a patient in primary pneumothorax, if the size is less than 2 centimeter, we have to discharge the patient. We have to follow up the patient. Simply nothing to do. If it is more than 2 centimeters, then we have to aspirate. It's called this for primary. For secondary, the cutoff is 1 centimeter. Less than 1 centimeter, you have to give high flow oxygen. High flow oxygen. 1 to 2, beta, you have to aspirate. Greater than 2 centimeters, you have to place chest tube drain. You have chest tube drain. And again, primary में बेटा less than 2 कुछ नहीं करना है, greater than 2 to just aspirate. In the secondary pneumothorax, 1 centimeter से बेटा कम है, you have to give oxygen. 1 to 2 centimeter, you have to aspirate. Greater than 2 centimeter, chest tube drain डालनी है. Why high flow oxygen? What is the funda behind the high flow oxygen बेटा जो ऑक्सीजन है बेटा उस ऑक्सीजन में देखो दिस इज ब्लड. अगर मान लीजिए बेटा लंग एलिवेल है बेटा, इस लंग प्लेउरल कैविटी में एयर जमा हुआ है. इस एयर में बेटा नाइट्रोजन है, ऑक्सीजन है. नाइट्रोजन 78%, ऑक्सीजन है बेटा 21% जो इधर जमा है. इफ वी गिव हम एयर देंगे, फ्रेश एयर 100% फ्रेश एयर देंगे। 100% फ्रेश एयर, व्हाट विल दिस फ्रेश एयर कॉज? दिस विल कॉज नाइट्रोजन बेटा। अगर हम देंगे नाइट्रोजन शिफ्ट टुवर्ड द ब्लड, एयर रिमूव करेगा बेटा यहाँ से। ठीक है, आई एम अगेन रिपीटिंग दिस बेटा, ट्राई टू अंडरस्टैंड दिस कंसेप्ट बेटा। हाई फ्लो ऑक्सीजन क्यों देते हैं बेटा? देखो बेटा, ये प्लेउरल कैविटी में एयर जमा हुआ है बेटा। इस एयर में बेटा 978% नाइट्रोजन है और बेटा 21% बस ऑक्सीजन है बेटा। अगर हम बेटा करेंगे कोशिश, जो सराउंडिंग में है, जो हम हाई फ्लो ऑक्सीजन देंगे, ये ट्रैप्ड एयर है, निमोथोरैक्स ये ट्रैप हो चुका है यहाँ पे बेटा। अब हम इस एरिया को कम करना है, एरिया को कम करना है। अगर हम नाइट्रोजन को बाहर निकालेंगे, दैट मीन 78% हम निकाल रहे हैं, तो बचा क्या? 21% only. That means the volume will get shrunken. How we will remove this 78% from the air? That is high, which is to high flow oxygen. और जब हम high flow oxygen, the blood, the surrounding blood vessels, उनमें जो बेटा नाइट्रोजन कंसंट्रेशन वो डिक्रीज होती जाएगी, डिक्रीज होती है। There will be a gradient. This from this pneumothorax to the surrounding vessels and this thing is the surrounding environment, the nitrogen concentration will decrease by giving high flow oxygen. So this air will get removed because it has the nitrogen portion get removed. When the nitrogen portion moves from high concentration to the low concentration, because nitrogen concentration falls outside due to high 100% oxygen. So inside air occurs only 21% oxygen. The volume gets shrunken. That is why we use oxygen inhalation observation, because it is less than 1 mm. 20 present is with a right upper quadrant paid weight loss. Imaging reveals beta lesion in the peripheral enhancement. Lesion, liver lesion है बेटा। AFP was normal, CE was elevated, biopsy related adenocarcinoma. Adeno यानी gland forming lesion है, adenocarcinoma with dense fibroid likely foci क्या है बेटा? AFP normal है, CE AFP अल्फा फेटोप्रोटीन बेटा, अल्फा फेटोप्रोटीन नॉर्मल है। दैट मीन ये लिवर वाला तो नहीं है, तो लिवर ऑर्गन से तो नहीं हुआ। सीई दैट मीन ये पेंक्रियाज या बिलियरी ट्रैक्ट से हुआ है बेटा। अब क्या है? एडिनो, ग्लैंड फॉर्मिंग ऑर्गन से। ग्लैंड फॉर्मिंग ऑर्गन जो भी बायोप्सी जो लेजेंड था बेटा, वो ग्लैंड फॉर्मिंग है। कैन इट बी ए हेपेटोसेल्युलर कार्सिनोमा? नो, इट कैन नॉट बी ए हेपेटोसेल्युलर कार्सिनोमा। क्यों नहीं हो सकता हेपेटोसेल्युलर कार्सिनोमा? बिकॉज दिस पेशेंट हैज hepatocellular carcinoma. It is not a gland forming beta, it is an hepatocellular carcinoma, because we are saying it is an adenocarcinoma, gland forming and not a hepatocellular. What can it be? A metastasis, because primary given nahi hai, primary tumor kahin option hi nahi hai ki it had a primary tumor. It cannot be. Can it be a hepatoblastoma? It cannot be a hepatoblast, again because gland forming nahi hai। hepatoblastoma glands तो नहीं है, it consists of hepatic cells at all, तो नहीं होगा ये। और ये हेपेटोब्लास्ट में चाइल्ड्स में होता है बेटा, और हेपेटोसेलुलर फिब्रोलैमेरी ये यंग पेशेंट्स में होता है बेटा। तो अगेन डाउन बचा कौन? इंट्राहेपेटिक कोलेंजियोकार्सिनोमा। इंट्राहेपेटिक कोलेंजियोकार्सिनोमा बेटा एएफपी नॉर्मल होता है, सीईए लेवल एलिवेटेड होती है बेटा, एंड इट रिजेम्बल्स बेटा, इट रिजेम्बल्स, याद रखना, इट रिजेम्बल्स, ठीक है बेटा, इट रिजेम्बल्स हेपेटोसेलुलर कार्सिनोमा। गॉट इट? अगेन आई एम रिपीटिंग दिस बेटा, अगर मास आएगा, हेपेटिक मास लाइक लीजन आएगा, और एडिनोकार्सिनोमा गिवन होगा, ग्लैंड फॉर्मिंग लीजन होगा, लिवर में लीजन होगा, ग्लैंड फॉर्मिंग, इट विल बी अ कोलेंजियोकार्स, इंट्राहेपेटिक कोलेंजियोकार्सिनोमास। ठीक है, AFP नॉर्मल है, अगेन AFP नॉर्मल है, पेशेंट AFP नॉर्मल, पॉइंटिंग आउट दैट इट्स नॉट अ लिवर लीजन, बट हाँ हेपेटोसेलुलर कार्सिनोमा फिब्रोलैमिनर वेरिएंट में भी AFP है, लेकिन एज डज नॉट कोइंसाइड विद इट बेटा। ठीक है, now the question is emergency department after injection several types amitriptyline. Amitriptyline is tricyclic antidepressant. It is a tricyclic. Now patient is drowsy and hypotensive, develop generalized tonic-clonic seizures after several, which are the chronic disease most likely to be seen in this patient. TCA toxicity बेटा, TCA toxicity में बेटा characteristic याद रखना बेटा, characteristic TCA toxicity में there is an prominent R wave, there is an prominent R wave, prominent R wave in AVR lead. Prominent R wave in AVR lead. This is an characteristic form, this ECG change in याद रखना बेटा, TCA toxicity there occurs prominent distinct characteristic. How most common finding क्या होती है बेटा? It is in tachycardia, sinus tachycardia. याद रखना, most common finding is sinus tachycardia. Can it be a broad curious complex with prominent terminal RV? Yes. Scoped ST depression is with shortened QT interval. It is seen in beta digitalis. Scoped ST depression. Scoped ST depression digitalis में होता है. Sinus bradycardia with AV block is seen in again is seen in digoxin. Bradycardia beta is seen in digoxin. Ventricular bigeminy is seen in digitalis. Ventricular bigeminy scoped ST depression is seen in digitalis. Overdose. ठीक है बेटा, is seen in digitalis overdose. Prominent R waves is seen in बेटा TCA. याद रखना बेटा, फिर से बोलूंगा मैं, prominent R wave in AVR, याद रखना, in AVR lead, prominent R wave is seen in tricyclic antidepressant. Ventricular bigeminy is seen in the digitalis and scoped ST depression. When scoped ST depression and ventricular bigeminy is seen in the digitalis. Digoxin causes bradycardia. Important one more thing, but a patient है, इस patient's malignant hypothermia. What is the dosage of this dantrolene? Important thing, dosage बेटा normally जो हम it is reconstituted in the city royal water. Normal saline में नहीं यूज किया जाता है, ये इंपॉर्टेंट याद रखना. डेंट्रोलिन हम सिटी डेंट्रोलिन, इसके लिए हम जो जिसमें हम इसको रिकन्स्टिट्यूट करते हैं, दैट solvent, the dilute which use is beta, it is city royal water, not normal saline. नहीं है बेटा, डेक्सट्रोज नहीं है, एक ही ऑप्शन बचा बेटा, वो बचा बेटा yes, 2.5 mg per kg and it is reconstituted with city royal water. याद रखना, डेंट्रोलिन city royal water, याद रखना बेटा. Patient has a hypertension with hypokalemia, always mineralocorticoid excess syndrome, Liddle syndrome जो हम बोलते हैं, mineralocorticoid excess. But what is then question is not telling that with the most important screening test for this suspecting primary aldosterone. बेटा screening test हमेशा होता है aldosterone renin ratio. Primary aldosterone is a screening test. Saline infusion test is a confirmatory test. This is a beta फ्लो चार्ट. सस्पेक्ट अगर हम मिनरलोकॉर्टिकॉइड एक्सेस कर रहे हैं बेटा, स्क्रीनिंग टेस्ट इज एन APR, aldosterone renin ratio. Then we do a confirmatory test. Confirmatory test is better. This saline infusion test is a confirmatory test. Saline infusion test. AV one is the diagnosis, confirmatory. It will help in the localization, right left management में ये मदद करेगा. But screening याद रखना, ये दो screening and this is confirmatory test for primary aldosteronism. ठीक है. पॉपकॉर्न कैल्सिफिकेशन है बेटा, मैमोग्राम चूज a category of disorder. Popcorn calcification in breasts is seen in the fibroadenoma. Fibroadenoma कौन सा है बेटा? It's a benign disorder and benign disorder classification is given by ND बेटा. Breast benign classification is given by ND. Abscess तो नहीं है, blunt trauma तो नहीं है, because popcorn calcification है तो it is seen in this. Fibroadenoma is a benign, तो neoplasia भी नहीं है, बचा एक ही ND. It is given by ND classification. Which are the following that is started in a patient in bronchial asthma patients को है बेटा, वो dupilumab थेरेपी पे स्टार्ट किया गया है. डिपिलिमाब इट्स अ मैकेनिज्म ऑफ एक्शन बेटा, इससे पूछा जाता है ये किसके थ्रू एक्ट करता है बेटा, ये क्वेश्चन पूछा जाया है, डिपिलिमाब किसके थ्रू एक्ट किया गया है बेटा. इफ वी सी बेटा इंटरल्यूकिन 4 बेटा, डिपिलिमाब इज एन इंटरल्यूकिन 4 इनहिबिटर. इंटरल्यूकिन 5 बेटा is it is inhibited by mepolizumab and benralizumab. Interleukin 5 is inhibited by this mepolizumab and benralizumab. Mepolizumab and benralizumab. Here, interleukin 4 and 5 no, because 5 is done by mepolizumab and benralizumab. Interleukin 5 no. What is this? Thymic stromal lymphopoietin. Thymic stromal lymphopoietin is targeted by it is targeted by TZP-lumab It is formulated by lumumab. Lumab. It is not by dupilumab. It is not by dupilumab. Interleukin 4. There is one option left, that is interleukin 4 and interleukin 13. This is an important thing. Interleukin 4 is inhibited by dupilumab, and mepolizumab and benralizumab causes inhibition of this interleukin 5. देखो बेटा, साइजोफ्रेनिया पेशेंट था, एंटीसाइकोटिक थेरेपी फिर अब उसको एमेन्यूरिया हुआ एंड बायलेटरल मिल्क डिस्चार्जेस यानी गलेक्टोरिया, सीरम प्रोलैक्टिन लेवल हाइप्रो. दिस पेशेंट वाज एंटीसाइकोटिक्स, प्रेग्नेंट फीमेल एंटीसाइकोटिक्स पे था. इस पेशेंट थी वो एंटीसाइकोटिक्स पे था, अब इसको गलेक्टोरिया इन्हें मिल्क डिस्चार्ज आ गया एंड देयर इज हाइपरप्रोलैक्टिनोमा in this patient. What are the causes of this beta? This is a beta side effect of this and typical antipsychotics. This is a beta side effect of typical antipsychotics. Typical side this antipsychotics, they cause hyperprolactinoma and galactoria. However, antipsychotics, typical versus atypical. In the atypical one, but it's mostly commonly, this side effect is caused by antipsychotic and it's mostly caused by this typical one. Among the atypical ones, there are two atypical antipsychotics given in this quetiapine and risperidone. Quetiapine is an risperidone. Typical, this chlorpromazine, haloperidol, these are all typical antipsychotics and they cause this galactoria and hyperprolactinoma. Among the atypical antipsychotics, quetiapine has a less prolactin. Quetiapine causes less hyperprolactinoma. But among the atypical antipsychotics, risperidone is an exception. It causes hyperprolactinoma. Remember this better. Hyperprolactinoma is caused by typical antipsychotics and risperidone, which is an atypical antipsychotics. So among their risperidone, because it is an atypical antipsychotics, it causes chlorpromazine, haloperidol, and these are typical. Bacha kaun? Quetiapine will be the answer. This is a bit of fact-based question, and this is an exception. You have to remember that. Question number 36, beta. Question number 36. Depression है, irritable bowel syndrome, experiences both mood and gastrointestinal but after high fiber diet intervention. IBS patient who had given a fiber diet and it shows improvement in mood as well as bowel. What in this fibers causes the improvement in these movements? Question is asking like that. क्या है इनमें बेटा जो इनको इंप्रूवमेंट मिल जाती है बेटा? सिंपल बेटा, जो फैट है बेटा, डाइटरी फाइबर्स है हमारे, colonic microbes जो है बेटा, that converts fibers into short chain fatty acids. Short chain fatty acids, for example, butyrate, acetate, or propionate. Fibers are converted into short chain fatty acids. For example, butyrate, acetate, and propionate. And among them, the butyrate beta, it is important for gut-brain signaling. It is important for gut-brain signaling, and it has an anti-inflammatory effect. That is why beta butyrate is answered. Beta serotonin and this ghrelin beta appetite hormone है, ये तो पता ही है बेटा. Peptide, why this is satiety hormone beta. Ghrelin is an appetite regulation hormone beta. Got it? But this cannot be answered. So it is short chain fatty acid. Among them is only short chain fatty acid. Okay. No question. Again a question. Question number 37. 37-old boy with a recurrent fractures following a tribal trauma sinus infect. The mother also reports the child has hearing difficulty. Following recurrent, patient has a recurrent fractures. His father also shows has a history of multiple fractures, has a history of multiple following minor injuries. After minor injuries, patient has multiple fractures, X-rays given. What are the pathogens of this condition? Better. If we see better, the X-ray is not uploaded in this. I think there is an error something. If we see the image, if we go and see the GT and see the image, there are with the femur, and if we see this, there are in the X-ray there are given these like lines, like these are known as metaphyseal bands. These are known as metaphyseal bands are given. These metaphyseal bands, fathers also having the recurrent fractures following minute traumas, is suggestive of Osteogenesis Imperfecta. Hearing defect. Whenever there occurs a bone defect and a bone fractures with hearing defect following this in a patient, always think about Osteogenesis Imperfecta. This Osteogenesis Imperfecta occurs due to defect in collagen 1 synthesis. Osteogenesis occurs defect in the Osteogenesis Imperfecta occurs in the collagen 1 defect. Mineralization, defective mineralization of osteoid is a problem in rickets. And mutation gene encoding carbonic anhydrase 2. Carbonic anhydrase 2 mutation is seen in the osteopetrosis. And hydroxylation of proline and lysine is seen in the scurvy. Defect in hydroxylation of proline and lysine residues are seen in these patients. 30-year-old female with a paroxysmal HLV start in deltaism for the rate control. Our next week, he recurrent episodes of sudden lightheadedness and a brief. ECG is shown below. I'm not, I don't know what is happening to these, why ECG is not here, why images are not being uploaded here. I will check this one is better. Ambulatory ECG is shown below. Which underlying condition was the patient is suffering from. This was the ECG given for this patient. If we see clearly better, what condition the patient is from? Is an old patient, old age patient. Here better, if we go for question number 38. Old age patient develop sudden onset lightheadedness and brief syncope at ambulatory ECG were done. In the ECG, there we say there is an here P, QRS and T. P, QRS and T. Each P is followed by QRS complex, and there is a bradycardia. There is a bradycardia in this patient. There is a bradycardia in this patient. There is nothing is abnormal in this P wave or QRS complexes and T wave. They are normally following, but the pace has been slowed down. That means this SA node that generates this P pulse at all, that generates pulse, is a dysfunction in this patient. And SA node dysfunction in an old age patient is characteristic of the sick sinus syndrome. Is characteristic of this sick sinus syndrome. I hope. Sick sinus syndrome, normally it occurs in old age patients. You will find it's also sometimes known as Tachybrady syndrome. A subtype of this sick sinus syndrome. It's also known as Tachybrady syndrome. In the sick sinus syndrome, there may be sometimes persistent sinus bradycardia, sinus arrestus may be there, and there may be a sinus tachybradycardia. Normally, patients have old age, and there may be something, for example, patients in AF. It is treated now. Patient develops this kind of syndrome. This is known as the age-rated. This sick sinus syndrome. Wolff-Parkinson-White syndrome. Why it's not Wolff-Parkinson-White syndrome? Because there must be a delta waves. Delta waves are not here. and Stokes syndrome, and there may be a complete AV block. There is an AV block, beta, transient AV block, and this is SA node dysfunction. Try to remember that 6 sinus syndrome is a dysfunction of the SA node. SA node. Either the pulse is generated or pulse is not generated. If it is generated, it will be completed. That means P, Q, or S is completed. Then there will be the pause, P, Q, R is completed. Another pulse will come, it will be followed. In Stockholm, there is an AV block. Subclavian syndrome, it is better this subclavian artery syndrome. There is nothing to do with the ECG at all. Question number, which of the following is not associated with secondary Raynaud's phenomena? Is not associated. इनमें से कौन secondary नहीं है? Secondary means there are already the vascular phenomena, the vascular issues are there. Because of that, the Raynaud's phenomena has happened. Primary, there is a central and local response. Systemic lupus erythematosus is again a secondary locus because it affects the arteries. Scleroderma affects the arteries. Verges affects the arteries. Atherosclerosis affects the arteries. Except Raynaud's is itself a primary disease. Rest all are the secondary causes because they affect the arteries. Secondary occurs from the vascular insufficiency. Question number 14. Moving to the question number 14. A 3 weeks old in unit, but 3 weeks, evaluation for the first joint. Mother reported that the baby has dark yellow urine and pale clay colored stools and second. देखो बेटा, clay colored stools, dark urine, these means an conjugated bilirubin is increased. Whenever the conjugated bilirubin, there occurs a urine and pale color stools. Mild hepatomegaly, lab universal reveals predominantly conjugated, yes, hyperbilirubin. Which are the following most likely diagnosis? 3 weeks neonate है बेटा. 3 weeks neonate है और second week of life से ही इसको बेटा ये stool grey color आएगा और joints है बेटा. Can it be a physiological joints? Can it be a pathological breastfeeding or breast milk joints? Which of the following will it be? Better. What is pathological? Joints that persists for more than 2 weeks. Because baby is already 3 weeks. That means one criteria is following. And joints which occurs within 24 hours. Or rapid increase in there is a conjugated hyperbilirubin. Again, देखो बेटा, pathological में बेटा more than 2 weeks का है ये. और it is conjugated hyperbilirubinemia. What about this physiological joint? Physiological joint is usually occurs after 24 hours of life and it resolves by 1 to 2 weeks. And it should resolve by 1 to 2 weeks of life. Here, the patient is 3 weeks of life. That means physiological joint is out. It's not after 2 weeks. What about the pathological joints? That's it. What about the breastfeeding joint? Breastfeeding, it occurs in the first week of life. Because of inadequate breastfeeding, patient feed properly नहीं कर रहा है because of breast feeding की वजह से इसको बेटा डिहाइड्रेशन की वजह से इसको फर्स्ट वीक के अंदर अंदर ही होता है बेटा. पेशेंट कितने है बेटा 3 वीक्स का है. दिस इज गॉन. ब्रेस्ट मिल्क जॉइंट बेटा आफ्टर फर्स्ट वीक्स क्या होता है? आफ्टर फर्स्ट वीक्स बेटा होता है because milk में there is a normal stool and urine color. It is unconjugated hyperbilirubinemia. I am again telling this बेटा how to approach this question बेटा. अगर बेटा आपके पास आ गया न्यूनेट आया, न्यूनेट आप 2 चीज देखोगे. 2 चीज क्या देखोगे बेटा? आप एज देखोगे बेटा. क्या ये लेस देन 1 वीक है, 1 to 2 वीक्स है और ग्रेटर देन 2 वीक्स है बेटा. लेस देन 1 वीक्स में ब्रेस्ट फीडिंग जॉइंट्स आता है. 1 to 2 वीक्स में बेटा फिजियोलॉजिकल आता है बेटा. और ग्रेटर देन 2 वीक्स में इसका ब्रेस्ट मिल्क आता है बेटा, सॉरी ग्रेटर देन 1 वीक्स में, ग्रेटर देन 1 वीक्स में ब्रेस्ट मिल्क आता जाता है, और ग्रेटर देन 2 वीक्स में बेटा ये आ जाता है, ग्रेटर देन 2 वीक्स में पैथोलॉजिकल आता है। Now how to remember this? The above three are beta. These are unconjugated, and the only one that is a conjugated variable is a pathological. I hope ये आंसर आपको मिल गया बेटा। ठीक है बेटा। 24 OPD according to this 24 HFS guideline, what they recommend upper limit for sodium intake बेटा, sodium and salt, these are two things जहाँ पर पेशेंट परेशान होते हैं हमेशा, नीड PG एस्पिरिन। सोडियम is बेटा always it should be less than 2 grams, upper limit 2 grams का होता है पर डे सोडियम का, एंड साल्ट का बेटा हाई साल्ट इंडेक्स का 5 ग्राम्स होता है बेटा, याद रखना सोडियम 2 ग्राम्स, साल्ट 5 ग्राम्स अपर लिमिट होता है बेटा, इट शुड बी लेस देन 2 ग्राम्स, नॉट मोर देन 2 ग्राम्स, 5 ग्राम्स बेटा साल्ट का है, नॉट सोडियम का। दिस इज एन वैक्यूम, दिस इज नेगेटिव दिस ड्रेसिंग बेटा। क्वेश्चन नंबर 42 बेटा, question number 42 is vacuum assisted closure, ये देखिए उन्हें, which are following is contraindicated, because vacuum assisted it is used to increase healing बेटा, कब ये यूज किया जाता है, पहले बेटा अगर नेक्रोटिक मटेरियल है या कुछ भी डेब्रिस है वो रिमूव करने होते हैं बेटा, सब कुछ क्लीन करना होता है, देन इट सक्स द दिस फ्लूइड एटसेट्रा एटसेट्रा, उसको रिमूव कर देता है। व्हाट आर द कंट्राइंडिकेशन बेटा, अगर वेसल्स होंगे ना बेटा टॉप पे, सुपरफिशियली वेसल्स लेवल या वेस्कुलर ट्यूमर्स होंगे या कुछ मेलिग्नेंसीज होंगी बेटा, देन इट इज कंट्राइंडिकेटेड बिकॉज़ ब्लड फ्लो, ये ब्लड फ्लो इंक्रीज करे, दैट मीन्स ब्लीडिंग रिस्क ज्यादा है। अगर ट्यूमर्स है बेटा, मेलिग्नेंसी अंडरलाइंग है, तो ये प्रोपेगेट करेगा, उनको मेटास्टेसिस करेगा बेटा। अगर देंगे बेटा सर्जिकल वॉन्ड डिहेशंस, उनमें यूज होगा, हाँ यूज होगा बिकॉज आफ्टर दिस डेब्राइडमेंट एट ऑल ये इनको हीलिंग प्रोसेस करते हैं। डायबिटिक फुट अल्सर में, बेड सोर्स में, क्या ये दिस मार्जिनल अल्सर में यूज होगा, बिकॉज मार्जिनल अल्सर इज it is a beta, it is a beta, right? Marginal अल्सर is again बेटा it is itself a tumor, ठीक है बेटा, इट इज एन ट्यूमर बेटा, जो अल्सर से ट्यूमर बन गया है बेटा, इट्स एन मार्जिनल अल्सर, इट्स अ ट्यूमर। सो इन ट्यूमर्स वी डोंट यूज, कहाँ कहाँ यूज नहीं करेंगे बेटा, अगर वेसल सुपरफिशियल है वहां हम यूज नहीं करेंगे, एक्सपोजर वेस्कुलरिटीज अगर है बेटा, नेक्रोटिक टिश्यूज एस्कॉर्स अगर है बेटा, वहां पे भी इसको यूज नहीं, पहले इसको क्लियर करना है, सब कुछ क्लियर करना है, देन इट शुड बी यूज्ड। अगर बेटा मेलिग्नेंसी है बेटा, देन इट शुड नॉट बी यूज्ड। 43 बेटा, which are the following is planned for liposuction under tumescent anesthesia? What is a tumescent anesthesia? But it is a diluted solution of lidocaine plus epinephrine. Tumescent anesthesia because large amount of anesthesia हम स्किन के अंदर डाल देते हैं, जिसकी वजह से फिर लार्ज वॉल्यूम ऑफ डाइल्यूटेड एनेस्थीसिया हम सबक्यूटेनियस फैट में डाइल्यूट करते हैं, फिर इसको this lipoma as at all this liposections करते हैं बेटा, लाइपोसक्शन करते हैं बेटा। कौन कौन सा है बेटा, इसमें होता है लिडोकेन प्लस एपिनेफ्रिन होता है बेटा, इट कंटेन्स लिडोकेन एंड एपिनेफ्रिन। व्हाई, बिकॉज लिडोकेन बेटा एनेस्थीसिया देगा और एपिनेफ्रिन बेटा वासोकंस्ट्रिक्शन ये देगा बेटा, दैट इज द फंडा बिहाइंड दिस लाइपोसक्शन के लिए। क्वेश्चन कभी आएगा, व्हाट इज इट इज एन डाइल्यूटेड लोकल एनेस्थीसिया। For example, बेटा अल्ट्रा शॉर्ट एक्टिंग एनेस्थीसिया, अल्ट्रा शॉर्ट एक्टिंग रेमिफेंटेनिल बेटा, देखना दिस इज एन अल्ट्रा शॉर्ट एक्टिंग, सुफेंटेनिल एंड फेंटेनिल दीज आर द शॉर्ट एक्टिंग, रेमी इज एन अल्ट्रा शॉर्ट याद रखना बेटा। एन ऑटोक्लेव इज यूटिलाइज्ड इन द स्टोरेज द watery medium contains the सिक्रू कैप्ड बोतल बेटा, अगर सिक्रू कैप्ड बोतल है ना बेटा और स्टरलाइजेशन है, ऑटोक्लेव स्टरलाइजेशन है, तो प्रोसीजर क्या करेंगे हम, कौन से यूज करेंगे, क्या हम टाइटली कैप फिटल बोतल करेंगे, जो बोतल हमारे पास है सिक्रू, क्या उसको टाइटली हमें बंद करना है, क्योंकि ये गिलास होता है, गिलास के अंदर हमें टैप कैप होता है, क्या हमें टाइटली बंद करना है या लूजली बंद। अगर हम बेटा टाइटली यूज करेंगे जो हम स्टीम देंगे इनसाइड प्रेशर बढ़ जाएगा। प्रेशर जब बढ़ जाएगा तो गिलास टूट सकता है बेटा। दैट मीन्स टाइटली कैप्ड नहीं होना चाहिए, लूजली होना चाहिए। क्या लूजली होना चाहिए? हो भी सकता है लूजली, बिकॉज जो भी स्टीम, जो प्रेशर बढ़ जाएगा वो रिलीज हो सकता है। रैप बोतल इन थिक फॉइल, क्या हम बोतल, जो बोतल हम यूज करेंगे बेटा, क्या उसके बाहर हम कवर लगा देंगे? अगर हम बाहर कवर लगाएंगे ना तो स्टीम करने का क्या फायदा है? देयर इज नो फन ऑफ डूइंग दिस स्टीम बिकॉज दिस विल एक्ट एज अ बैरियर एंड इट विल नॉट स्टरलाइज दिस यूजिंग ड्राई हीट इंस्टेड। ड्राई हीट इज नॉट यूज्ड फॉर दिस बेटा। Dry heat is used for glassware, powders, oils, fats. It is not for aqueous culture media बेटा। ये मीडिया के लिए नहीं इस्तेमाल होता है, ठीक है बेटा। ऑटो के लिए और ड्राई हीट, ड्राई हीट इज फॉर गिलास विलास, कौन कौन ड्राई करेंगे बेटा। लेकिन मीडिया कहाँ, मीडिया फ्लूइड को कहाँ करेंगे हम बेटा, ठीक। क्वेश्चन, 47 all multiparous women present with intermittent greenish nipple discharge। बेटा याद रखना बेटा, greenish nipple discharge, greenish nipple discharge जहां पे भी होगा ना, जहां पे इट इज डक्ट एक्टेजिया, डक्ट एक्टेजिया ब्लड होगा, it can be duct ectasia, it can be tumor, and it can be tumor also. Green discharge, it can be duct ectasia. The image, no discrete best palpebral. Which of the following is the most appropriate initial management? Most appropriate initial management is better for an duct ectasia is conservative management with antibiotics. It is in conservative management with antibiotics. MRM बेटा ये सीए ब्रेस्ट को हम करते हैं। डक्ट रिसेक्शन बेटा कहाँ करते हैं बेटा, अगर लार्ज एब्सेस होगा या कुछ होगा। कीमोथेरेपी, क्या रोल है बेटा इसमें, कुछ नहीं, कैन बी इन ट्यूमर्स में, बिनाइन में तो कोई यूज नहीं है। Which of the following is not prevented? अगर हम बेटा corticosteroids, if we are giving the corticosteroids and antenatal failures, if we are giving corticosteroids, then the antenatal which cannot be prevented. Respiratory system, it can be prevented. Interventricular hemorrhage can be prevented. Necrotizing enterocolitis can be prevented. However, hypoglycemic seizures cannot be prevented with steroids. How? Why? Because in the antenatal period, if we give steroids, steroids can cause increase in glucose in mother as well as in fetus. Once the fetus is delivered, there occurs because of high glucose due to corticosteroid, there occurs an high insulin due to high glucose. By reflex feedback, by feedback mechanism, there will be insulin. Insulin will be increasing. This insulin increase can cause again hypoglycemia back. That is why hypoglycemia seizures are not prevented by antenatal corticosteroids. Demographic cycle observed by stationary population beta. A researcher is studying a demographic study, but in demographic cycle, beta कहाँ stationary? Where is the stationary population located? Which stage? If we know beta stages in a demographic population, stage 1 is known as high stationary. Stage 2 is known as early expanding. 3 is known as late expanding. Fourth one is known as low stationary. And fifth one is known as declining. These are the phases of the demographic cycle. This is a demographic cycle. He observes, would he, the demography, in which stage he observes a stationary population. It shows a stationary population. It doesn't specify high or low. There are two the stationary population. High stationary phase, and in stage 4 is a low stationary phase. That means stage 1 and stage 4 will be the answer. If it specifically mentions high stationary phase, and go with stage 1. If it mentions low, then stage 4. 32-year-old woman present with intensely pruritic flat topple villuses or papules or the flexor wrist. Fine whitish reticulate lines. Fine whitish reticulate lines are seen on the surface of the fine whitish reticulate signs. Beta, it is a characteristic beta when you see it is a pruritic flat topple villuses papules on the flexor of the lichen planus. pruritic, plain toppered, papules on the flexor. This aspect, this is seen. This is known as beta lichen planus, and fine whitish reticular lines. Fine whitish reticular lines are known as Wickman's stria. These are known as Wickman's stria. And acute sign is seen in this, as you know, beta is seen as psoriasis beta, and pseudocopnar sign is seen in warts and molluscum contagiosum. Warts and molluscum contagiosum. Copner's phenomena is a condition seen in psoriasis as well as lichen planus. Question number 50. 52-year-old type 2 diabetes started on oral anti-diabetic drug lower glucose by promoting urinary glucose excess. Glucose. A few years later, he developed bulging and diagnosed urinary tract infection. The tract acted by glucose reabsorption. बेटा सबको पता है बेटा HGLT2 inhibitors, सोडियम ग्लूकोज ट्रांसपोर्टर्स बेहाइज बेटा वो कहाँ पे होते हैं लोकलाइज, वो पीसीटी में लोकलाइज होते हैं बेटा. That is why glyphosate, they act on this and they cause glucose excretion and it causes UTI in patient. तो सिंपली टाइप 2 डायबिटीज ड्रग बेटा वो कहाँ पे एक्ट करता है, बाय प्रमोट ग्लूकोज एक्सक्रीशन. जो ग्लूकोज एक्सक्रीशन करेगा बेटा दैट इज एन प्रोग्राम कन्वर्टेड टू गोल. देयरफॉर इफ वी सी बेटा डायूरेटिक एक्शन बेटा मैंने आपको दिखाया है बेटा दिस इज प्रोग्राम कन्वर्टेड पुल. यहाँ पे हमें चैनल होता है HGLT2 इनहिबिटर बेटा. यहाँ पे होती है लूप ऑफ हेनलीज में हमें बेटा होता है सोडियम पोटेशियम 2 क्लोराइड चैनल. यहाँ पे होती है सोडियम क्लोराइड को ट्रांसपोर्टर DCT में होती है बेटा. इधर चैनल जो आपको याद रखने हैं टाइप्स ऑफ डायूरेटिक्स मैंने यहाँ पर लिखे हैं बेटा कौन कहाँ पे देते हैं. these are the this what's called a loop of Henle में यहाँ पे हमारे पास furosemide torsemide. These are drugs which act on this distal convoluted tubule में thiazides करते हैं. loop diuretics में loop of Henle में act करते हैं and carbonic anhydrase inhibitors acts on the PCT beta. These are drugs which these are the mechanism of side of action of this diuretic action you have to remember beta. So main thing this is telling that HGLT2 inhibitors कहाँ पे होता है वो बेटा PCT में होता है. थिक असेंडिंग लूप ऑफ हेनली में बेटा हमारे पास 2 सोडियम पोटेशियम क्लोराइड चैनल्स होते हैं. तो कलेक्टिंग डक्ट्स में वो पोटेशियम स्पेयरिंग ड्रग्स हम यूज कर सकते हैं. ठीक है. A primary criteria came for counseling regarding safe labor practice. She asked whether umbilical cord will be clamped immediately after birth, whether the episode is a routine performed in all first vaginal deliveries, which are following the most appropriate advice regarding to current recommendations. बेटा current recommendations में क्या है बेटा safe this labor बेटा this what's called safe labor practices बेटा क्या होता है क्या routine episiotomy is recommended only in pregnant and the umbilical cord should be clamped at least 30 seconds after birth in vigorous means normal बेटा. But normally the routine episiotomy is not recommended and cord clamp हम बेटा देखते हैं normally it should be done after 60 seconds. Routine episiotomy is not favored. याद रखना बेटा routine episiotomy is not a good safe labor practice and this cord clamp is usually done after 60 seconds. Now we will see routine episiotomy is not recommended. Umbilical cord should be clamped at least 60 seconds after birth. Yes, it is a characteristic beta. Nothing. This is an important thing. This in a normal baby beta on primary or multigravidas, nothing routine episiotomy is not recommended at all. Now remember this beta. 53 years old postmenopausal and undergoes an endometrial biopsy. 53 is a postmenopausal woman. Postmenopausal woman अगर बेटा endometrial hyperplasia है with atypia है or without atypia. Listen to me. How to approach this case beta. How to approach endometrial hyperplasia with atypia if it is an premenopausal due to progesterone. Give directly progesterone if it is an postmenopausal. Now, if it is a simple hyperplasia or complex hyperplasia. Complex means it has a bit and has a symptomatic and it has a bleeding at all. Complex, always go with the progesterone. Premenopausal, go progesterone. If it is a postmenopausal, having symptomatic at all, always use progesterone. Now it is asymptomatic and then you can follow without therapy. If it is a simple hyperplasia, If it is simple hyperplasia, if it is mentioned in the question, it is a simple hyperplasia, then you go with this flow chart. If it is not mentioned, always mark that it is a complex hyperplasia. Then we can go follow up with our therapy. Here it is not mentioned; it is simple, so we will take it as a complex hyperplasia. That means we have to give him a progesterone. If it is an endometrial hyperplasia with atopia, then if in premenopausal pregnant, in premenopausal we have to go total abdominal hysterectomy. In perimenopausal, there is again a total abdominal hysterectomy. In postmenopausal, you have to go total abdominal hysterectomy plus bilateral salpingo-oophorectomy. This is a treatment flowchart plan, beta. 40-year-old female, kidney failure with serum creatine. But kidney failure, serum creatine is used in calculate surgery. But which of the following muscle relaxant cannot be used? Simply, which of the muscle relaxant is contraindicated in kidney failures? Simple बेटा. किडनी फेलियर्स में कौन कौन सा बेटा कंट्राइंडिकेटेड है बेटा? किडनी फेलियर्स में बेटा याद रखना याद रखना बेटा, किडनी फेलियर्स में एनेस्थेटिक ड्रग्स कौन कौन सेफ नहीं है बेटा, याद रखना बेटा. Enflurane, sevoflurane. These are the inhaled anesthesia which are not safe, जो बेटा नहीं देना है किडनी फेलियर में. सेकंड, इंट्रावेनस में कौन है बेटा? बेंजोडाइजेपिन्स. Benzodiazepines are not safe. I am telling about not safe drugs. Kidney failure. Inhalational drugs हमने बोला एनफ्लोरिन एंड sevoflurane. इंट्रावेनस ड्रग्स हमने बोला बेटा ओपियोइड्स में बेटा मॉर्फिन. मॉर्फिन इज नॉट सेफ बेटा. मॉर्फिन एंड मिपेरिडीन जो एम से वाले हैं, जिनमें एम होगा वो सेफ नहीं है बेटा. मसल रिलैक्सेंट में बेटा पैनक्यूरियम, नोन एज रोक्यूरियम. Pancurium, rocurium, and D-tubocurine. These are unsafe beta. These are the unsafe drugs in this case. Here you will find option and mark these are the unsafe drugs. You have lists बनाओगे पे unsafe drugs in this. Rest all safe drugs. This is a beta. That redness around the cheek is this erythema, and there are well-defined margins. This is known as erysipelas. Versus cellulitis. Cellulitis में बेटा no boundary defined होती है, well-defined boundary नहीं होती है वहाँ पे, and both are caused by this known as this Streptococcus organisms. These are the streptococcal infections. What are the other streptococcal infections? Cellulitis is other, necrotizing fasciitis is other, and impetigo. These are the infections caused by cellulitis. ठीक है, I'm talking about cellulitis, necrotizing fasciitis, and impetigo. These are other infections caused by streptococcus streptococcal infections. Now, tell me better. Middle-aged man which has been diagnosed with short bowel syndrome and given a parenteral nutrition. Short bowel syndrome है बेटा, इसको parenteral nutrition. All of the following are about parenteral nutrition. What are the सब सही है बेटा parenteral nutrition के बारे में. What one is accept बेटा? Centrally venous access can be achieved through subclavian vein. Yes, subclavian vein के through we can give centrally accessed. This peripherally inserted central venous catheter can produce irreversible thrombophlebitis. Yes, it can produce irreversible thrombophlebitis. Peripheral feeding can be used for more. No, it cannot be used more than 7 days. It cannot be used more than 7 days. Peripherally inserted catheter, जहाँ पे हम जैसे parenteral nutrition, it can be given by via peripherally or via centrally. Centrally is given by a subclavian vein or internal jugular vein or external jugular. Mostly subclavian vein and infraclavian subclavian vein is used. The tip of the subclavian vein should be at the level of superior vena cava. ठीक है बेटा. Side effect, it causes everything decreases, but it causes the hyperglycemia. It causes the hyperglycemia, right? Hypokalemia, hypomagnesemia, hypo. It causes hypo. It causes hypo everything, but it causes the hyperglycemia. It causes the refeeding syndrome also. In the refeeding syndrome, you can say phosphate, calcium, and magnesium is decreased. In refeeding syndrome, try to remember PCM is decreased. Phosphate, calcium, and magnesium is decreased. Beta. Catheter-induced sepsis is also a complication. Try to remember that peripheral catheter cannot be used more than 7 days. Limit is 7 days. After that, you have to change that catheter. Centrally, you can use it. 60-year-old man with a carcinoma planium for major abdomen upper GI surgery has severe weight loss and hypovolemia. The surgical team starts special enteral formula enriched with arginine, omega-3 fatty acids and nucleotides. Pre-operatively, ये nutritionist क्यों देना है? What is the funda behind giving the nutritionist pre-operatively to this patient? What is the benefit? Benefit prevention from refeeding syndrome? No. For preventing refeeding syndrome, you have to give slowly, short segment, small quantity. Reduction in post-operative infection, maybe. Rapid correction of anemia, no, you have to give iron, B12, something at all. Prevent post-operative new alias, no, you have to give electrolytes at all. That means this is the reduction in the infection. That is why we are giving the nutrition pre-operatively. ठीक है बेटा. A new screening test for fetal test is being evaluated. Which are the following validity parameters most critical for the test to be used in population for screening? For the screening purpose, beta, the test should have a high sensitivity. For screening हम वहाँ करेंगे. We will do screening where we find that there is a possibility that there are large number of cases that we need to find the cases so that we cannot miss them. If we move their treatment get delayed and they will have a fatal complication. They will die, those patients. So the test should have a high sensitivity. High sensitivity means a true positive. It should detect that these cases which are having the disease. It should be have a high sensitivity. If test is positive, that means the patients have the disease. That is why it should have a high sensitivity beta. High predictive value. It is based on the prevalence of the disease beta. It is based on the prevalence of the beta. False to predict high predictive value is based on the prevalence of it. It does not show the test detects the true or not. It doesn't. It depends on how prevalent of the disease. It depends on the prevalence beta. Sensitivity and specificity are independent of this prevalence. But specificity means true negative. True negative cases beta. If a test is negative, that means the disease does not have. If the test is negative, that the patient does not have the diseases. That is why in a screening process, the main objective is to detect the true cases. In screening, the main objective is to detect the cases. As many cases as we detect so that we can treat them, we can prevent them from the complication. That is why it should have a high sensitivity beta. Why patient again is better high accuracy? High accuracy, why it cannot be better? High accuracy can be falsely high beta. If a disease is low prevalent beta. Suppose if a beta is it is low prevalent. If a disease is low prevalent. If a beta is beta, if a disease is low prevalent. ठीक है बेटा. If a beta disease is beta low prevalent in any areas, but tests will not be able to detect those things which are very low, which are not common, That is why we use a screening which are high sensitivity in a true positive rate. That is that if a patient have if any patient in the country, if any patient in the community has a disease, it should be able to detect. That is why it's known as high sensitivity and a highly true positive. High accuracy can be falsely high in low prevalent diseases. Suppose what it mean beta? Accuracy means beta. Suppose test is given and it shows a true negative. It shows a true negative. We take a test, but the disease is not much prevalent. Not much prevalent. ठीक है बेटा. We did a test and diseases was present, but test shows it was a negative. But I am again repeating this question, beta. 1 minute. I'm again repeating this question between accuracy and sensitivity, high sensitivity beta. देखो बेटा, accuracy, it may be falsely high. It may be falsely high. Why it may be falsely high? If a disease is low prevalent. If a disease is low prevalent. Why? Why? If a disease is low prevalent, we did tests. Suppose 100 patients, only one patient has diseases. And we did a test, it shows us 99 are negative. That means it's a true negative. Now, due to true negative cases, we will tell that this patient accuracy has a very high, because it shows all the 99 cases are negative. Only one case is in positive. That means the accuracy of the test is very high, very high. But does we need that? Because in screening, we need to find tests which are very positive, I'm again repeating this question. I am repeating this question again. Ankit bhai? Hello? Ankit bhai? Question number 57, but I am repeating this question. For screening the test, question number 15. New screening test for a fatal but treatable disease is being evolved. Which are the following validity parameters most critical for the test to be useful in a population screening program? For the screening of the patient, we need to main objective detect the as true cases as possible. To detect as true cases as possible. जितने ट्रू केसेस हम डिटेक्ट कर सके उतने में the true cases sensitivity means beta true positive. So the screening for the screening of the patient should have a high sensitivity, because it depends on true positive. Sensitivity means a true positive. It does not depend on the prevalence of the diseases or not prevalence of the diseases. So sensitivity, whether the diseases are prevalent or not prevalent, it doesn't matter. If a disease is present, it will detect that. Depending on other positive predictive values and high accuracies, it depends on the prevalence of the diseases. If a prevalence is low or a high, these two they will vary, but the sensitivity and specificity, they will not depend on this prevalence of the disease. That is why for screening, if we are doing any screening tests, so we need to find out tests which will be able to detect the disease. By detecting the disease means that true positive will be seen in high sensitive cases, and by true negative will be seen in high specificity. But we are trying to find the cases. That means we are finding the screening, we are finding the cases so that we can treat them. That is why we will use a high sensitivity. Now going on to the question number 58. 50-year-old woman with an end-stage renal diseases is diagnosed with an autosomal dominant polycystic kidney disease. Which of the following is not extrarenal manifestation? बेटा extrarenal manifestations आपको याद रखना है क्या क्या होती है polycystic kidney disease. Hepatic cysts होते हैं, liver disease तो पता ही है बेटा, mitral valve prolapse होता है, colonic diverticulosis होता है, abdominal wall hernia. याद रखना बेटा, hepatic cysts, mitral valve prolapse, colonic diverticulus, abdominal hernia. These are the four things जो आपको याद रखने हैं बेटा. Ovarian cysts ये नहीं होती है. There may be aneurysms as well. Sorry, aneurysm भूल गए. There may be intracranial aneurysms as well. 5 things. All of the following changes in a patient's behavior size increasing risk of suicide. Increasing risk of suicide क्या क्या हो सकता है बेटा? Patient recovering from a suicide depression, risk of suicide. what are the increased risk? किस patient में, which of the following the patient has increased risk बेटा? देखो बेटा, this is an important thing. Patient recovering from a suicidal depression. If a patient having depression, if it is recovering from that beta, this after recovering from the depression, there may be increase in drive and activity before suicidal thinking has fully settled. It is not a recover, it is a recovering from. If it has recovered, that means it's a good thing, but it is recovering, it is recovering. That means if a patient has a suicidal thought, and if it is a recovering, that means it's excitement from the depression. From depression, it is getting excitement. That means it is thought of going for the suicide will increase. It will change into the action. It may increase drive and activity. So increasing the risk of acting on a plan, because patient has a plan in depression to go for a suicide. Now he is recovering because the plan was in after slowly getting recovered. This there will be imbalance of these hormones. Now from depression it goes into slight excitement, and slight excitement at the plan formulated depression may actually came into the action after slightly getting improved. Patient with a history of multiple suicide attempts, that means it will improve. Sudden peace of mind, sudden. It is a dangerous thing. If a patient was in a depression now, it suddenly becomes a calm. Suddenly, it's not a gradual. Suddenly becomes a sudden peace of mind. Reflects a risk. He has he has decided something, and now he has set it a plan. That means he is now calm because he has planned or something. That means it's also a risk. Patients depression but having very low energy state. This patient has already very low energy state. This does not take already interest in some other thing. Already he just wants to sleep at all. Doesn't matter what other things. That is why low energy state is the best explanation I can give you for the beta. One more thing, which are the following general fertility? Which are the following is the general fertility rate for the district? General fertility rate. What is the general fertility rate? How it is calculated? Beta GFR, general fertility rate. It is beta calculated number of live births in a year divided by live births. Beta it is divided by total women in reproductive age. Beta 15 to 49. It is multiplied by 1000. LFR number of live births बेटा live births in a year. एक year में number of live births जब total women live births in this patient are 3600 in a year. And what are total women? Female population or married women? It means total women, doesn't matter whether they are married or unmarried. It includes the total women. What is the total population? Total population is this 48,000 multiplied by 1000, and it comes around 75. 75 will be the answer. Here in 48,000 female population, it also includes also married women, because women are also females. That is why I included this total population. An elderly man is undergoing an elective distal gastrectomy with due to lymph node dissection. The surgery becomes prolonged and lasting for more than six hours. This is better antibiotic. This is better antibiotic prophylaxis. What does this antibiotic prophylaxis start? Antibiotic prophylaxis tells that better pre-operatively we have to give antibiotics to the patients, and intraoperatively every 4 hours. If a surgery is prolonged after 4 hours, you have to give antibiotics. In 4 hours is the limit. Every 4 hours we have to give better. Every 4 hours we have to give this antibiotic to the patients. Question number 62. Brought to the lethargy and seizures, mother says that she has a pink crystals on diaper. Glutamine level was elevated in addition to urinary levels of orotic acid high है बेटा. spring crystals है. What metabolic abnormality is likely seen on ABG analysis बेटा? Question है बेटा. 7-8-year-old boy है with lethargy. Mother also says pink crystals in the diaper. Has a pink crystals in the diaper. Elevated, there is a glutamine level is and with orotic acid level. That means orotic acid, glutamine, pink crystal, orotic acid. That means it's in urea acid. There is a defect in the urea cycle. What metabolic abnormality may be seen in ABG analysis in this patient? Beta. Let us decode this patient. Let us decode this patient. Elevated level up. Glutamine is elevated in this patient. Here, the patient in this patient is that there is an elevated glutamine in the blood and there is an orotic acid. Orotic acid is synthesis. These are two things mechanical. Orotic acid obviously is in ornithine. Ornithine is in orotic acid, and ornithine is seen in the urea cycle. That means we are dealing with the urea cycle, and orotic acid is increased. Now, question is telling what are the metabolic abnormalities seen in the ABG analysis in these patients. Now, let us see what are the metabolic abnormalities that we can be seen in the ornithine carmine deficiency. Glutamine is an ammonia that's in hyperammonemic condition. If we see beta, if there is a condition, if there is an ornithine transcarbamylase deficiency, that is the reason why this ornithine is increased. Ornithine gets into ornitic acid, and that is why this ornithine. Sorry, this. Again, I am going to repeat this 72 question. Repeat this 17. Question number 72. I am repeating this question number 72. Beta. How to go for the 72. Patient is brought to the lethargy seizure. Mother says she has a pink crystal in the diaper. Has a pink crystal diaper. There is elevated level of additions in the urinary level of orotic acid. Orotic acid levels are increased in the patient, and glutamine levels are increased. Hyperammonia, glutamine is an ammonia, and glutamine level is increased. Whenever there is glutamine level is increased and orotic acid level is increased, that means orotic acid level, if you see in this urea cycle beta, orotic acid level is increased in the is seen in ornithine transcarbamylase deficiency. It is seen in the transcarbamylase deficiency. How? Because ornithine carbamyl phosphate gets accumulated because of deficiency of ornithine transcarbamylase. This carbamylase phosphate is converted into orotic acid. This orotic acid causes pink crystals in the diaper. Try to remember, whenever orotic acid is increased, this causes pink crystal diaper. This causes a pink diaper. Pink diaper means ornithine transcarbamylase deficiency. Okay? Hyperammonia. Now, this patient has a hyperammonia. Hyperammonia causes the stimulates the respiratory. This causes the stimulates the respiratory center. This leads to tachypnea and hyperventilation. Tachypnea and hyperventilation causes excessive carbon dioxide loss. Okay, बेटा अमोनिया ज्यादा है, it stimulates central respiratory centers. Respiratory centers होगा तो क्या होगा? वेंटिलेशन ज्यादा होगी तो क्या होगा? कार्बन डाइऑक्साइड वॉश होगा. कार्बन डाइऑक्साइड वॉश होगा तो क्या होगा? रेस्पिरेटरी अल्कलोसिस होगा बेटा. ठीक है बेटा, इट इज एन रेस्पिरेटरी. ठीक है बेटा, गॉट इट. ओरोटिक एसिडूरिया बेटा, ठीक है बेटा. ओरोटिक एसिड पेशेंट में हाई है, इट मीन्स दैट इट इज एन ornithine transcarbamylase deficiency. Why? This causes the ammonia level to increase. कैसे ammonia level increase होगा? I'm again repeating this question. Sorry, I am repeating 72. Explanation of the 62 question again. Explanation of the question number 62 again. देखो बेटा कैसे होगा? Patient 62 baby is brought to the lethargy seizure. She has a pink crystals on the diaper. Pink crystals on the diaper is seen in beta in the deficiency of the O2C बेटा, ornithine transcarbamylase deficiency. How? कैसे बेटा? देखो बेटा, if you see the reaction, कार्बन डाइऑक्साइड अमोनिया बेटा मिलके बेटा कार्बोमाइल फॉस्फेट बनाते हैं। कार्बोमाइल फॉस्फेट मिलकर ऑर्निथिन के साथ मिलके बेटा ये सिट्रोलिन बनाते हैं। कौन? ओटीसी इनको कन्वर्ट करता है बेटा। जब ओटीसी नहीं है अवेलेबल, दिस कार्बोमाइल फॉस्फेट बेटा दिस accumulated, ये जो बेटा इसको क्या कहते हैं? दिस इज कन्वर्टेड बैक, दिस इज कन्वर्टेड इनटू ओरोटिक एसिड। दिस ओरोटिक एसिड gives a pink color crystals to the diaper. समझ? one point explained that orotic acid increased है, this orotic acid gives pink colored crystals. Now one is this carbomal phosphate, ये रिएक्शन ही फॉरवर्ड नहीं होगी बेटा। इसकी वजह से क्या होगा? दिस रिएक्शन गॉस आल्सो हैम्पर्ड एंड अमोनिया लेवल इंक्रीजेस। हाइपर यूरिया साइकिल का मेन काम है अमोनिया को डिटॉक्सिफाई करना बेटा। जब अमोनिया ही प्रॉब्लम है, देयर विल बी a high ammonia level. This high ammonia level beta, it causes stimulation of this respiratory centers. Respiratory centers causes ventilation causes carbon dioxide washout. This carbon dioxide washout causes alkalosis. Which alkalosis? Respiratory alkalosis. याद रखना बेटा, यूरिया साइकिल hyperammonia causes respiratory alkalosis, not acidosis. Try to remember everything. There was acidosis, there was one alkalosis, there is respiratory alkalosis. ABG is an important question. हाइपरअमोनिया इट कॉज यूरेटिक एसिड बेटा, यूरिया साइकिल डिसऑर्डर्स में नॉर्मली यही होता है बेटा, रेस्पिरेटरी अल्कलोसिस। आई होप दिस आंसर्स। Question number 63 beta. Chronic smoker comes to the emergency with complaints of the abdominal pain, nausea, vomiting. He has given a simple complaint previously, along with steatorrhea and weight loss. There is a calcification around the pancreatic head. Calcification is around the pancreas. Surgeon suggested chronic pancreatitis. MRCP was done. It was no obstruction of birth. But MRCP हुआ, कोई obstruction नहीं है, कोई mass नहीं है. What is an appropriate line of management? Chronic pancreatitis में बेटा पेशेंट का पेन एट ऑल है। हाउ टू मैनेज chronic pancreatitis patient with pain having no mass or no lesion? How we will manage this patient? We need to put the risk factors which causes the pain of this patient and treat the conservatively. This can we do Budd-Chiari's procedure? Can we do Frey's procedure? Can we do total pancreatectomy? No. Budd-Chiari's procedure is usually due to mass. अगर मास होगा बेटा पेशेंट्स को, देन क्रोनिक पैंक्रेटाइटिस में ये वाला पोर्शन हम निकालेंगे। फ्रेयर्स प्रोसीजर में अगर बेटा ओबस्ट्रक्शन होगा बेटा, ओबस्ट्रक्शन बेटा है, अगर ओबस्ट्रक्शन है क्रोनिक obstructive pancreatitis, then we use it helps us in drainage of this pus abscess as well. Total pancreatectomy beta, it is contraindicated as intra mortality, high rate and post-operative prognosis. That is why beta we will go with quit smoking and treat conservative if there is no mass and no obstruction. Mass होगा then Budd-Chiari's procedure, head फ्रेयर्स प्रोसीजर, ओबस्ट्रक्शन टेल वेल में अगर कहीं पे भी होगा बेटा ओबस्ट्रक्ट पैंक्रेटिस में कुछ ओबस्ट्रक्शन होगा वही गो फ्रेयर्स प्रोसीजर। 64 beta. Which of the following statement is false regarding? Which of the following statement is false regarding the emergency contraceptions beta? Emergency contraceptions beta. Emergency contraceptions prevent, they also prevent implantation, they also prevent fertilization, both. Now, levonorgestrel 1.5 mg single dose, yes, it is given, or 0.75 mg BD, it is also given. Ulipristal 3 mg, no, ulipristal 30 mg beta. 30 mg is the dose taken beta within 5 days, not 3 mg, 30 mg बेटा याद रखना बेटा। ये पूछा गया है, बहुत बार इसको पूछा गया है बेटा। देखो बेटा, a patient with excessive bleeding during his examination symmetrically enlarged uterus, याद रखना बेटा, corresponding 12 weeks, then less than 14 weeks, 12 to 14 weeks, symmetrically enlarged. Diagnosis endometriosis interna, also known as beta adenomyosis. It is an adenomyosis, कोई नया नाम नहीं है, adenomyosis. What is the best treatment for this beta? Best treatment for the adenomyosis is beta, it is an best treatment. What is the best treatment for adenomyosis? Is hysterectomy. Best treatment is telling about best treatment, that is hysterectomy बेटा। ठीक है बेटा। व्हाट इज द मैनेजमेंट बेटा? हम मैनेज इनिशियली करेंगे बेटा, स्टार्ट करेंगे हिस्ट्रोस्कोपी विथ क्यूरेटाज. इफ फर्स्ट स्टेप विल बी हिस्ट्रोस्कोपी विथ क्यूरेटाज बेटा. हिस्ट्रोस्कोपी इज द इनिशियल स्टेप ऑफ मैनेजमेंट. इनिशियल स्टेप, अगर बेटा इनिशियल स्टेप होगा, अगर बेटा इनिशियल स्टेप होगा, इट इज एन इनिशियल स्टेप, not best. Best is total hysterectomy beta. Best is always total hysterectomy. Which are the false hemibellismus? Oh बेटा good. Hemibellismus में बेटा लीजन कहाँ पे? ये बेटा सिंपल से याद रखना है. Hemibellismus is seen in the subthalamus. There will be a violent, large amplitude flinging movements on one side of the body. This is hemibellismus. Hemibellismus is the subthalamus. कोरिया बेटा, कोरिया मीन्स फ्लिकरिंग ऑफ मूवमेंट्स पोटामेन में होते हैं बेटा. एसिटोसिस बेटा ग्लोबस पेलिसिटस में लेजन होगा, कंटिन्यूअस राइडिंग मूवमेंट. कॉर्डेट में कॉग्निशन में प्रॉब्लम होगी बेटा. पोटामेन में लेजन होगा, कोरिया होगा बेटा. ग्लोबस पेलिसिटस में होगा, एसिटोसिस होगा. सबथैलेमस हेमिबेलेमस होगा. कॉर्डेट न्यूक्लियस में कॉग्निशन में इंफ्यूड होगा. What is the बेटा? Which of the following development मैंने बेस्ट दिस एक्सप्लेन दिस कंडीशन. देखो बेटा ये यहाँ पे भी जाता है, यहाँ पे यानी मीडियल रेक्टस लेटरल रेक्टस. ओके ये ठीक है, इसका मीडियल रेक्टस ठीक है, सेंटर पे दोनों हो गए, ये नॉर्मल पोजीशन है. अब इसका मीडियल रेक्टस ठीक है, इसका बेटा लेटरल रेक्टस प्रॉब्लम है बिकॉज ये यहाँ पे एंड पे नहीं गए. दैट मींस इफेक्ट देन इशू इज विद लेटरल रेक्टस. अगर ये राइट आई है बेटा, अगर ये लेफ्ट आई है, मीन लेफ्ट लेटरल आई is effective. Lateral eye को कौन सप्लाई करता है? We also know SO4 superior oblique is supplied by the fourth and LR6. Lateral rectus is supplied by the cranial nerve 6. Cranial nerve means 6 nerve nucleus. There is a 6 nerve nucleus problem. While working as a resident in the hospital, you are asked to consult to prescription and proton pump inhibitor beta. It should be given orally daily before breakfast, even though it is half time is no more than 3 hours. What is the rationale behind one dose? But अगर इसका half life, if its half life is only 3 hours, why it is giving OD before breakfast once a day? Why it is giving? Because बेटा देखो क्या होता है, PPIs बेटा क्या होता है बेटा, PPIs ये बेटा प्रो ड्रग्स होते हैं, ये बेटा प्रो ड्रग्स होते हैं बेटा. इनको एसिड कैटालाइज करता है, इनको एक्टिव फॉर्म में वो कन्वर्ट करता है. वंस दे आर एक्टिवली कन्वर्टेड कैटालाइज्ड पैरेटल सेल्स ऑफ स्टोमक में होता है, दे उनको बेटा ये एब्जॉर्ब होते हैं. फिर ये क्या करते हैं बेटा, ये लास्ट स्टेप ऑफ बेटा दे ब्लॉक हाइड्रोजन पोटेशियम ATPase enzyme. This is the last step beta, which secretes the H positive, which secretes the beta final step in the ferritin, which secretes the final step involved in the production of this gastric acid. That is why beta this final step, even though कहीं से भी क्यों ना बना हो एसिड, ये फाइनल स्टेप ब्रोक करता है. इट irreversibly inactivates the sodium potassium pump, its secretion. That means तब एसिड तब बन जाएगा जब न्यू पंप्स बेटा बन जाएंगे. व्हाट अगेन आई एम टेलिंग यू बेटा, पीपीआईज प्रो ड्रग्स होते हैं बेटा. प्रो ड्रग्स बेटा एसिड उनको कन्वर्ट करता है एक्टिव फॉर्म में. दिस एक्टिव फॉर्म irreversibly binds to hydrogen potassium pump. This hydrogen potassium pump, it is a final step. It secretes the H positive, which then combines with this chlorine to form the HCl and acid, and this irreversibly binds to this pump, and this acid will make only when this pump regenerates, new regeneration, and this takes 24 to 48 hours regeneration of this new pump. ताकि न्यू जब तक नया पंप बन जाएगा बेटा तब तक इसको चिपक के रहता है, ये हटता नहीं है वहां से. इट ब्लॉक्स irreversibly. So when is new pump regenerated, that is why it is effective, even though इसका जो what's called half life 3 hours ही है, but it's still able to manage this blockage of this level. Now progressive early steady weight loss upper GI endoscopy reveals diffuse thickening without a discrete ulcerative thickening. Biopsy in the image as a root modified breast cancer. Mother had a breast cancer at 42 age. Genetic testing reveals a mutation in which of the following gene. देखो बेटा, this is an gastric cancer बेटा. This is a beta diffuse. Patient has a diffuse thickening of the stomach, means it has a diffuse gastric tension, and it shows a signet ring cells. If you see beta, there are signet rings. There are beta signet ring. Signet. The ring is beta. The signet ring in this biopsy is most commonly hereditary diffuse gastric cancer. Hereditary diffuse gastric cancer is caused by the beta GDH and beta C. This MLH1 is caused by beta Lesch syndrome. It is usually seen in Lesch syndrome. C-kit beta is seen in जिसमें बेटा होता है वहां पे हेरिडिटरी गैस्ट्रिक कैंसर्स नहीं होते हैं बेटा CDH1 signature cells always go with CDH1 mutation beta. Which of the following fracture site has the highest risk of avascular necrosis? But avascular necrosis के लिए common sites आप याद रखो. Waist of the scaphoid, femur head बेटा होता है, ये most commonly होता है बेटा. Talus होता है बेटा और humerus head. These are the avascular necrosis sites. बेटा scaphoid होता है, scaphoid, femur head, humerus head and talus. Given यहाँ पे scaphoid देखो बेटा, scaphoid of Dundo and scaphoid and in the waist of the scaphoid. This is the most commonly beta. Second thing is that waist of the scaphoid bone. Site 1 is in waist of the scaphoid. ठीक है. फीमर हेड में नेक्रोस होती है लेकिन नेक में फ्रैक्चर होता है, याद रखना बेटा. फ्रैक्चर कहाँ पे होता है? नेक फ्रैक्चर, बट हेड में नेक्रोस होगा बेटा. यहाँ पे स्कैफॉइड में एवास्कुलर नेक्रोसिस होगा बट वेस्ट ऑफ द स्कैफॉइड फ्रैक्चर होगा, याद रखनी है दो चीजें. Which are the following structure not a content of the broad ligament? बेटा broad ligament में आप rule of 2 याद रखो. इसमें 2 ligaments होते हैं, 2 nerves होते हैं, 2 arteries होते हैं बेटा. याद रखें कौन कौन सी nerve होती है? Ovarian और uterine. Ovarian vessel and uterine vessel होती है बेटा. इसमें होता है fallopian tube होता है और फिम्ब्रेज नहीं होता है बेटा. ये देखो ये अगर यूट्रस है बेटा, ये अगर सपोज दिस इज यूट्रस, दिस इज एन fallopian tube and this is an फिम्ब्रेज and this is an ovary बेटा. ये बेटा ये वाला जो पोर्शन है जिसमें ब्रॉड लिगामेंट बेटा, ये ब्रॉड लिगामेंट है बेटा. फिम्ब्रेज आउटसाइड होता है और fallopian tube इसका पार्ट होता है बेटा. ये फिम्ब्रेज आउट होते हैं बेटा, fallopian tube इसका पार्ट नहीं है बेटा, याद रखना. दिस फिम्ब्रे ऑफ द fallopian tube is part but फिम्ब्रे इसके नहीं होते हैं बेटा. फिम्ब्रे ऑफ द fallopian tube is not a part of it. ठीक है बेटा. At 1-year-old child with a normal male is operated on for bilateral and undissected testes with inguinal hernia. During exposure, surgeon finds a small uterus and with fallopian tube like situation. The was different semilical was also present. यानी ये मेल है बेटा. मेल में क्या हुआ, इसको बेटा स्मॉल यूट्रस भी था और fallopian tube भी था. अगर बेटा यूट्रस मेल था बेटा, देखो समझने वाली बात है, इसका एक्स वाई ये मेल है, मोस्ट लाइकली इन्वॉल्व इन दिस पेशेंट. देखो बेटा ये मेल पेशेंट था, मेल पेशेंट में हमें यूट्रस मिला. ठीक है. नॉर्मली मेल पेशेंट्स में क्या काम होता है? एंटी मुलेरियन हार्मोन बेटा ये होता है. इसका काम क्या है? ये यूट्रस यानी फीमेल ऑर्गन्स को ये बंद करता है, मेल में ये बनने नहीं देते. एंटी मुलेरियन हार्मोन इट स्टॉप्स uterus and other female related organs from developing in the male. Now this patient has some uterus in at all. What will be the effect? Which hormone has a problem? Of course it is an anti-mullerian hormone because it has developed uterus in at all. That is why testosterone means अगर testosterone में problem हो, if there is a problem in the testosterone, then testes, penile and other some analogical body difference will not be there, or they are there. That's testosterone में कोई issue नहीं है. There is no issue in the testosterone. The patient complains of vertigo and oscillopsia whenever exposed to sound, sirens and loud. Examination reveals sound-induced nystagmus sensory neuron. Tullus phenomena is present. Tullus phenomena. बेटा ये कहाँ पे होता है? Tullus phenomena is seen in sound-induced nystagmus indicated the Tullus phenomena. It is बेटा जब sound से बेटा इसको nystagmus vertigo सब कुछ होगा. That's known as बेटा, this is known as Meniere's disease. It is seen in the beta Meniere's disease and sensory neural hearing loss. बेटा try to remember. Otosclerosis में क्या होगा बेटा? Otosclerosis में बेटा ये बेटा फीमेल्स को होता है. मोस्टली, और ये मेल्स को होता है बेटा, मेल इज इक्वल टू फीमेल। सेकंड थिंग इसमें बेटा कंडक्टिव हेयरिंग होता है, इसमें सेंसरी न्यूरल हेयरिंग लॉस होगा बेटा। ये दो चीज होता है बेटा। ऑटो ये यूनिलेटरल होगा बेटा, और ये बायलेटरल होता है बेटा, याद रखना। दिस इज एन इम्पोर्टेंट, मोस्ट इंपॉर्टेंट थिंग। इन दोनों को कैसे डिफ्रेंशिएट करेंगे बेटा, ठीक है। एकॉस्टिक न्यूरोमा भी बेटा, इसमें भी यूनिलेटर हेयरिंग लॉस होगा, टेनाइटिस होगा, इम्बैलेंस होगा, बट एपिसोडिक वर्टिगो इज नॉट, एपिसोडिक वर्टिगो नहीं होता है इसमें बेटा, ठीक है। अगर ग्लम्स ट्यूमर होगा बेटा, इसमें भी कंडक्टिव हेयरिंग लॉस होगा, इसमें सेंसरी न्यूरल हेयरिंग लॉस होगा, ठीक है। इन दिस कंडीशन ओनली टू, यानी मिनेरस डिजीज इन एकॉस्टिक न्यूरोमा, मिनेरस डिजीज इन एकॉस्टिक न्यूरोमा, इसमें क्या होगा बेटा, इसमें मिनेरस डिजीज में सेंसरी न्यूरल, और एकॉस्टिक न्यूरोमा में सेंसरी न्यूरल, दोनों में हेयरिंग लॉस ये है, बट देयर इज एन प्रोग्रेसिव टेनाइटिस एंड एपिसोडिक वर्टिगो। टेलीवस phenomena is not seen in this acoustic neuroma. Oh, cherry red spot. Cherry red spot is seen in this. It's a characteristic बेटा, simple है। इस पेशेंट है, इसको बेटे कम विथ complete sudden painless loss of vision, याद रखना बेटे, there is a loss of vision, not diminution of vision. Fundus examination shows a cherry red spot. It is seen in the central retinal artery occlusion. Loss of vision, याद रखना बेटा, loss of vision. What is seen in this uh, BRO? What is seen in this case? There is also a sudden loss of vision. There is also a sudden loss. There is also a sudden loss of vision. There is loss of, actually there is also visual failure, not vision. There is sudden loss of vision. There is a sudden loss of vision. There is not seen a sudden loss of this. And what is fundoscopy? In fundoscopy, in fundoscopy, we will see a cattle tracking or box core appearance. Cattle tracking and by box core appearance is seen in this, and BRVO is seen. In this case, we will see the retinal hemorrhage. The retinal hemorrhage. There is a only the diminution of vision in these cases. Loss of vision is seen in CRO, and CRVO is blurring of vision. Blurring of vision again. Again, I'm telling you that central retinal artery occlusion, there is a loss of vision. Central retinal vein occlusion, blurring of vision. In these cases, branch retinal vein occlusion, there occurs a visual field loss. There occurs a visual field loss. Retinal occlusion, there occurs a box core appearance. All cattle, this cattle tracking. Branch retinal vein occlusion, there occurs a retinal hemorrhage will be seen, and there is a cotton retinal hemorrhage, cotton spots and edema is seen in this CRO. Blurring of vision will be there. Cherry red spots go with this case. CRAO. ठीक है बेटा। एनाफाइलेक्सिस में, एनाफाइलेक्सिस विद हाइपोटेंशन, एड्रेनलिन डोज क्या होता है बेटा, एनाफाइलेक्सिस में क्या होता है बेटा, एड्रेनलिन डोज। बेटा एड्रेनलिन डोज अगर आप देखोगे बेटा, 1:1000 एनाफाइलेक्सिस में होता है, 1:10,000 बेटा, 1:10,000 का जिसमें होता है 1:1000 बेटा, नॉर्मली हम यहाँ पे देते हैं, और एड्रेनलिन, और 1:1 लाख बेटा, आप याद रखोगे बेटा, ये इंपॉर्टेंट है, ये चीजें इंपॉर्टेंट है। 1:1000 बेटा, 1:10,000, 1 व्हाट्स कॉल्ड एज बेटा, ठीक है बेटा। आई होप दिस आंसर्स योर क्वेरीज, ठीक है बेटा। आई विल रिपीट 75, ठीक है बेटा, ठीक है। अंकित भाई, आई विल रिपीट क्वेश्चन नंबर 75, ठीक है बेटा। क्वेश्चन नंबर 75, एनाफाइलेक्सिस एंड हाइपोटेंशन विच लार्ज मिनट रिलीविंग पेंसिलिन। एनाफाइलेक्सिस में बेटा 1:1000 हम बेटा वहीं से दिया गया है 1:1000 डोज वी यूज एनाफाइलेक्सिस में, दैट मीन्स 1:1000 में हम यूज करेंगे बेटा व्हाट डज मीन 1:1000 मीन 1 mg/ml होता है बेटा, ये 1 mg/ml होता है बेटा, दैट मीन्स इफ इट इज 1 mg/ml इट मस्ट बी 0.5 mg/0.5 ml, यस सिमिलर टू दिस 0.5 ml होगा और 0.5 mg ऑफ एड्रेनलिन होगा बेटा। दिस इज समथिंग वी यूज बेटा इन दिस बेटा केस 1:1000 for immediate relief we use 0.5 ml of इंट्रामस्कुलरली वी यूज बेटा। याद रखना बेटा हम देंगे डोजेस एनाफाइलेक्सिस में हम देते हैं इंट्रामस्कुलरली 0.5 mg हम देते हैं, और हम देंगे बेटा कार्डियक अरेस्ट में हम देंगे आईवी हम देते हैं, उसमें भी हम देते हैं बेटा 1:10,000 1:10,000 हम देते हैं 1 mg 1 mg उधर देते हैं, इधर देते हैं 1:1000 1:10,000 1:1000 एनाफाइलेक्सिस में देते हैं, ठीक है। दिस इज समथिंग। और लोकल एनेस्थीसिया में देते हैं 1:2 लाख और 1:1 लाख हम मिक्स करते हैं लोकल एनेस्थीसिया के। दो चीजें याद रखना बेटा, एनाफाइलेक्सिस में हम देते हैं 0.5 mg देते हैं और IM देते हैं, और कार्डियक अरेस्ट में देते हैं 1 mg मगर आई भी देते हैं, ठीक है। ये दो डोज याद रखना बेटा। 76 मेल प्रेजेंटर्स विथ डिफिकल्टी इन हियरिंग, पीटीए गिवन है, व्हाट इंटरप्रिटेशन बेटा, पीटीए देख लेना बेटा, ये इंपॉर्टेंट है बेटा, पीटीए बहुत इंपॉर्टेंट है। देखा पीटीए, देखो बेटा इसमें क्या है, फर्स्ट ऑफ ऑल देखो दिस ब्लू कलर इंडिकेट दैट इज इन लेफ्ट ईयर, blue it means it's in left ear beta. This arrow indicates this in bone conduction beta, this is in bone conduction. X indicates this in air conduction beta. Now if we see the bone conduction beta, threshold is greater than 25 dB, 25 या 30 dB चला गया है बेटा, थ्रेशोल्ड स्टार्ट है 30 dB से स्टार्ट हो गया है बेटा। देखो बेटा 25 से ज्यादा है, एयर कंडक्शन का 15 dB से ज्यादा है, अगर आप देखोगे एयर कंडक्शन का 15 dB से ज्यादा, यानी इसमें बोन कंडक्शन में भी प्रॉब्लम है, सो एयर कंडक्शन में भी प्रॉब्लम है बेटा। फर्स्ट थिंग दैट वी विल से इट्स राइट एयर है कि लेफ्ट एयर है। सो फर्स्ट विद ब्लू मींस इट्स इन लेफ्ट एयर, सो लेफ्ट एयर में बेटा प्रॉब्लम है, gone, left ear is gone. Second thing, now we will go for the bone conduction में बेटा arrow this greater than bone conduction the starting point is more than 25, अगर less than 25 होता है बेटा that's normal, the threshold is 25, for air conduction it is 15 dB बेटा, it is started at 60, that means it is more than 15। तो bone conduction में problem है, that means sensory neural hearing loss, air conduction is abnormal, threshold means air conduction means it's in both conductive as well as hearing loss, air conduction में भी problem है बेटा। now so when there is a bone conduction as well as air conduction involvement, देखो बेटा कैसे करना है बेटा, अगर air conduction involved है it can be conductive as well as sensory neural hearing loss, conductive hearing loss, what to confirm then go for the bone conduction। if it is a bone conduction problem, अगर बेटा bone conduction में भी problem है then it's a sensory neural hearing loss, बेटा, it confers both bone and air conduction are abnormal, it indicates a sensory neural hearing loss, that means बेटा ये दोनों में होता है, अगर bone conduction it confirms नहीं बेटा ये sensory neural hearing loss problem है। point number third is airborne gap, इसमें ये air conduction bone, अगर airborne gap है बेटा, airborne gap it indicates that it is in conductive hear also, it indicated that it is in conductive hearing loss also, ठीक है बेटा, ये कंडक्टिव हेयरिंग लॉस भी है बेटा, दैट मींस इज मिक्स्ड हेयरिंग लॉस, लेफ्ट साइड मिक्सिंग हेयरिंग लॉस। हाउ टू अप्रोच बेटा, फिर से बोलूंगा बेटा, फर्स्ट गो फॉर एयर कंडक्शन, अगर बेटा एयर कंडक्शन एबनॉर्मल है इट इज कंडक्टिव हेयरिंग लॉस वर्सेस सेंसरी न्यूरल हेयरिंग लॉस, दोनों है, देन गो फॉर द बोन कंडक्शन, अगर बोन कंडक्शन में प्रॉब्लम है इट इज सेंसरी न्यूरल हेयरिंग लॉस। दिस और दिस, इट कैन बी बोथ दिस और दिस। हम पहले ये दो सुनते थे, आइदर या तो ये है या तो ये है, फिर इन दोनों को कंफर्म करेगा कि नहीं बेटा ये है। नाउ उसके बाद आप रखेंगे एयरबोर्न गैप। Earphone gap. If it is present, then it has a conductive hearing loss also. You can remember this like this way, but I will summarize like this. First, go for the bone conduction. ये bone conduction problem है बेटा, sensory neural hearing loss है बेटा। ठीक है, अगर ear conduction problem है, it can be sensory neural hearing loss or conductive hearing loss also. It can be both. ये दोनों में प्रॉब्लम होता है। उसके बाद कंफर्म करने के लिए दिस और दिस, ये दोनों हो सकते हैं बेटा, या तो सेंसरी न्यूरल हेयरिंग लॉस या कंडक्शन हेयरिंग लॉस, और बोथ या तो दोनों है। अब बोथ है कि नहीं है बेटा, वो कैसे पता चलेगा? हम करेंगे एयर बोन गैप। एयर बोन गैप इज प्रेजेंट, देन इट इज एन मिक्सड। दोनों बेटा, ठीक है बेटा, और ठीक है। आई होप दिस समराइज दिस इज एन इम्पोर्टेंट है बेटा। अगेन आई एम टेलिंग दिस, गो फॉर बोन कंडक्शन, प्रॉब्लम है सेंसरी न्यूरल हेयरिंग लॉस है। Go for air conduction, problem है, it can be sensory neural hearing loss, it can be conductive hearing loss, it can be both। अब both है कि नहीं है बेटा, both है कि नहीं है? already we know sensory neural hearing loss has confirmed by bone conduction, now it has sensory neural or this, now sensory loss we know, wow we have to confirm both है कि नहीं, क्योंकि sensory neural loss पहले ही पता चला है ये है, अब हमें पता करना है ये है, अगर ये भी है तो दोनों होंगे। तो क्या करेंगे हम करेंगे ईयर बोन गैप। अगर ईयर बोन गैप प्रेजेंट है तो दैट मीन्स इसमें बोथ। ईयर बोन गैप प्रेजेंट मीन्स हेयरिंग लॉस आल्सो। ईयर बोन गैप जब प्रेजेंट होगा तो कंडक्टिव हेयरिंग लॉस होगा, तो दैट मीन्स सेंसरी भी था, कंडक्टिव भी है, तो क्या होगा? इट इज अ मिक्सड हेयरिंग लॉस। ठीक है बेटा, विच ऑफ फॉलोइंग इंडिकेटर से एलएसएस या सुप्राप्यूबिक 3 सेंटीमीटर के अंदर ये वाला जो कर्विलिनियन इंसिजन होता है, दिस में फाइनेंशियल इंसिजन बेटा। विच ऑफ फॉलोइंग इंक्रीज सर्टन स्टेजिंग एनकेफेलोपैथी बेटा। स्टेजिंग ऑफ एनकेफेलोपैथी इसमें कौन सा इन्वॉल्व नहीं होता है? अगर आप देखो बेटा, दिस आर द कंपोनेंट्स ऑफ दिस, इज जस्ट ट्राई टू रिमेंबर द कंपोनेंट्स ऑफ एज क्या होती है? नो, टोन होता है बेटा, clinical to assess to him hypoxic ischemic is finding a certain include but gestational age बेटा। hypoxic ischemic encephalopathy में gestational age इन्वॉल्व नहीं होती है। you will not find any gestational age in this case बेटा। 80 बेटा, ठीक है बेटा। पेशेंट नंबर दिस, ठीक है, got it, oh in this is gone। uh, Patient present with itching of secondary on examination affected is hyperpigmentation with a non-tender subcutaneous nodule. The cause is subject to link it black phyllis, the flag phyllis बेटा, black phyllis। black phyllis is caused by, याद रखना है बेटा, पहले लोअर लोअर कौन करता है बेटा, ये तो फर्स्ट हमें याद रखना है बेटा। लोअर लोअर बेटा is caused by the mango files, लोअर mango files, जिनको हम बोलते हैं डे बाइटिंग फाइल्स, मैंगो फाइल्स और डे बाइटिंग फाइल्स। ठीक है बेटा। लिस्टमीनिया इज कॉज्ड बाय बेटा सैंड फ्लाई, मैंक्रोफ्टा इज कॉज्ड बाय द फीमेल क्यूलेक्स, ऑनकोरा ऑनकोसिरा वल्वुलस इज कॉज्ड बाय ब्लैक फ्लाइज। एक ही बच्चा बेटा वहां पे। अगर आप मुझे बोलोगे मुझे भी ऐसा नहीं आएगा, बट आई विल गो विथ, क्योंकि ये चीज हमें आती है। लोअर लोअर इज कॉज्ड बाय दिस मैंगोफाइलस और क्राइसोपस जीनस, लिस्टमीनिया इज सैंड फ्लाई, मैंक्रोफ्टा फीमेल एनाफिलिक्स, ऑनकोसिरा वल्वुलस इज कॉज्ड बाय ब्लैक फ्लाइज बेटा। क्वेश्चन नंबर 80 बेटा, याद रखना बेटा, दिस इज एन इंपॉर्टेंट क्वेश्चन। देखा बेटा, 2 years old child assessed during the village nutritional survey using the instrument shown below, जिसमें शेकर स्टेप बेटा, the reading follows the red zone में बेटा, यानी माल न्यूट्रिशन है, patient is malnutrition, severe malnutrition। Unfortunate child has appetite good है, no medical complication। क्या severe acute malnutrition बेटा, इसमें दो चीजें है, अगर बेटा appetite ठीक है और गुड कॉम्प्लिकेशंस नहीं है बेटा, कॉम्प्लिकेशंस नहीं है, तो हम इसको होम मैनेजमेंट कर सकते हैं। अगर बेटा एपेटाइट में प्रॉब्लम है या कॉम्प्लिकेशंस प्रॉब्लम है, हमें इसको हॉस्पिटल में ले जाना पड़ता है। हियर एक्यूट माल न्यूट्रिशन है लेकिन एपेटाइट भी अच्छा है, कॉम्प्लिकेशन नहीं है, तो हम इसको घर पे ही मैनेज कर सकते हैं। देयर इज एन alternate identified in range of required medical, no. Immediate parental nutrition, no. Empirical intervention antibiotics, no. Routine inpatient management नहीं बेटा। न्यूट्रिशन रिहेबिलिटेशन विद हाई, हाँ इसको हाँ करेंगे, हाई होम बेस्ड इज रिकमेंडेड बेटा। होम बेस्ड फूड ही हम इसको देंगे बेटा, जो मैं बोल रहा था आपको इसको, क्योंकि कॉम्प्लिकेशन नहीं है बेटा। गले क्वेश्चन इज एसोसिएटेड विद क्लासिकल ट्रायड। आप देखो, न्यूट्रोपीनिया, न्यूट्रोपीनिया, पेरिडोंटल एब्सेस एंड क्रोनिक इन्फ्लेमेटरी बाउल डिजीज, याद रखना बेटा। न्यूट्रोपीनिया सिर्फ एक ही पेज, न्यूट्रोपेरिडोंटल एब्सेस, देखो एडर दिस अंडर एंडरसन डिजीज, स्टोरेज डिजीज, कोरेज डिजीज है, वन गिरकिस डिजीज। में देखो बेटा, ए मीन्स बीज है, ब्रांचिंग एंजाइम डिफिकल्ट होता है, ठीक है बेटा। कोरेज ए, सी डी इज debranching enzyme is difficult in here, is difficult in here. And what is the Tories disease? Tories disease is beta. It is seen in this phosphofructokinase defect. It involves mainly muscle beta. ये muscle problem है. These are the problems of the liver, and this Anderson is liver problems. This Cory's disease is also liver issue. There may be hypoglycemia. There is a one disease where we find that there's a glucose 6 phosphate defect, is a microsmal enzyme defect. Glucose 6 phosphate transporter. Here, one Gerke's disease, 1A and 1B. If we see there is a cirrhosis, lactic acidosis, these are the characteristics you find: cirrhosis, hypoglycemia, hyperuricemia, hepatomegaly. Whenever liver is seen, you will find a hypoglycemia, hepatomegaly, etc. These things. But when it gets type B, characteristic is periodontal abscess, neutropenia, and chronic inflammatory IBD. These are seen in 1B. These are seen in 1B. Try to remember better. Triad of neutropenia, periodontal abscess disease, and chronic IBS. These are seen in 1B, not 1A. How will you differentiate 1A from 1B? Neutropenia, periodontal abscess, and these are not seen in this one Gitke disease. This is just an addition, ठीक है? 1B, one Gitke diseases. You will see better. One Gitke disease and others, and Anderson disease. Oh, I will repeat. Sorry, I will repeat 81 again. I will repeat beta 81 again. For you people, I will repeat 81. Question number 81 again. देखो बेटा, क्लासिकल ट्रायड ऑफ न्यूट्रोपीनिया, पेरिडोंटल एब्सेस, chronic and inflammatory bowel disease, glycogen storage disease. Tortoise disease, muscle, there will be a skeletal muscle problem that is not given in the option. This has gone. Now, Anderson, Cory's, and 1 year kid, these are the liver issues. There may be hypoglycemia, there may be hepatomegaly, there may be hypertension. But 1 year kid disease, there is a lactic acidosis. Now, that is not given in this option. Now, let us see. How will you differentiate Cory's disease and Anderson disease with each other? It's a present with, there may be a neutropenia. In Anderson disease, there may be a neutropenia, there may be an inflammatory bowel disease. But these are not characteristic. Like manifestations are not characteristic features. These are not seen here. Okay. Anderson disease, Rose disease, and one Gitke disease. These are all liver affected by the liver disease. Everywhere you see hypoglycemia, and there may be some hepatomegaly, etc. But in Meniere's diseases, that is a characteristic of neutropenia. There is a characteristic of periodontal abscess, and there is a characteristic of IB. This is in triad of 1B. This is in triad of 1B. Try to remember this. Triad of 1B is seen. Okay, got it? Okay, beta. 1A has not these features as well. Okay, beta. Triad of neutropenia, periodontal abscess, and chronic inflammatory is seen in one bigger case, type 1B, not 1A as well. 1B, not 1A as well. Not other this liver diseases involving liver diseases. क्वेश्चन नंबर 82 बेटा देखो बेटा सिंपली हाउ टू दिस बायोप्सी मार्कर्स को कैसे आप हाउ यू विल यू अप्रोच दिस फर्स्ट सी इफ इट इज 1920 पॉजिटिव और 3 पॉजिटिव इफ इट इज अ 1920 CD19 and 20 marker then look if 10 CD10 marker है CD5 5 positive or CD5 negative if it is CD10 positive then go for 6 positive है या 2 positive है if it has 10 CD19 20 positive 10 positive 6 positive then it goes DLBCL. Then if it has a CM1C KS60, then it goes a Brutus lymphoma. If it has a 2 positive, BCL2 positive, then it goes a follicular lymphoma. 1920 positive and 5 positive, then 5 positive, then it has a 2 subdivided into 23 positive and 23 negative. If 23 positive CLL, SLL or 23 negative is mantle cell lymphoma. Suppose beta in this patient, the patient is expressed as 2019 29 है बेटा पॉजिटिव है CD5 पॉजिटिव CD5 पॉजिटिव नेगेटिव फॉर 23 CD5 पॉजिटिव then it goes 23 negative it is a mantle cell lymphoma. Please try to remember this flow chart. I have simplified this. You can solve any question from this table beta. This is a simplified table how you can approach beta during immunization beta. Which are the vaccine most sensitive to heat exposure? बेटा कौन सा वैक्सीन है जो मोस्ट सेंसिटिव टू हीट है बेटा मोस्ट सेंसिटिव टू हीट बेटा फॉर दैट बेटा आई हैव रिमेंबर दिस आई हैव this read this mnemonic बेटा don't hurt people in this room because Japanese manner outshines because Japanese metal outshine बेटा जो this top last में है बेटा it is the most heat sensitive this is an less heat sensitive बेटा dilute tenders hep B penta IPV TT rota BCG, Japanese encephalitis, J vaccine, measles or MR beta, and outshine means OPV. OPV is the most heat sensitive. If it is a heat sensitive, that means the least freeze sensitive. It is vice versa beta. If you are telling which one the following is the most freeze sensitive, then dilute tenders and hepatitis B, which is freeze sensitive. This try to remember one. This is an heat sensitive. Heat sensitive. Beta heat sensitive, which is the most heat sensitive? OPV is the most heat sensitive. It is the least freeze sensitive. It is like that. Huh? Go. You have to remember these things like that. Huh? You suspect osteoid osteoma. Which are the following instruments to remove the entire nidus of this osteoma? Osteoid osteoma. कौन सा इंस्ट्रूमेंट हम यूज करेंगे बेटा osteoid osteoma को रिमूव करने के लिए? कौन सा now look at image 1 better this is a periosteal elevator can we use elevator for the removal of this nidus no second one is a curate it is a curate third is one an osteotome and fourth one is a bony gog now this is a periosteal elevator this is a periosteal elevator better anyway it is used with the periosteum now this bony gog is a concave blade beta it is used for cutting over the round bony surface. It is used for the cutting over the bony surface. This is an osteotome. Osteotome is used for the cut bones. This is used for the round surface. अगर bony round surface बेटा है bones का, it is used cutting the round bony surfaces. It is used or making the holes in the bones. अगर बेटा holes बनाने हैं या if round surface हमें bones का cut करना है then this is normally for the cutting of the bone and then curate it used for the remove the materials and nidus at all. Amyloid deposits in slide cordic. This what's called as amyloid deposit in senile cordic amyloidosis. कौन सा amyloid deposit होता है बेटा सिंपल सी बात है बेटा A type of amyloid. Why this gets deposit? A type of amyloid is seen in chronic inflammatory conditions. This is seen in chronic inflammatory conditions like rheumatoid arthritis. ठीक है बेटा like rheumatoid arthritis all. It can also be seen in this hereditary amyloidosis, secondary amyloidosis, secondary amyloidosis, hereditary. Transthyretin amyloid, it is seen in beta amyloid deposition. Transthyretin amyloid is seen in beta, it is senile condition is beta. Senile cardiac abnormalities. Amyloid light chain is seen in multiple myeloma beta, and beta 2 globin is seen in long-term dialysis. You try to remember. A type is seen in inflammatory condition. Transthyretin is seen in beta senile cardiac abnormalities. A type is seen in amyloid. Beta 2 microglobin is seen in. I hope you remember beta 2 microglobin is seen in this dialysis. Okay, beta. Again, there are two types of beta. This TTR, the normal variant is seen in, and there is a mutated variant. Mutated variant is seen in familial amylotropic this amyloidotic neuropathies. That you have to remember. There is you will find out that you have to always remember which of the following is seen in freshwater drowning beta. Freshwater drowning beta, water that will goes into the cells, these will swell and it will release the potassium from them, that will cause hyperkalemia. There will be a hyperkalemia. Hemodilution will be there because that will cause hyperkalemia, not hypokalemia. There will be a hyponatremia, there will be anemia, but not hypokalemia. Hypokalemia nahi hoga beta. Question number 87. 87 beta. After step OP poisoning है बेटा, atropine is administered followed by prolidoxime. Most this mean prolidoxime is an enzyme reactivator बेटा. It is an enzyme reactivator. जो OP है बेटा, OP क्या करते हैं बेटा, ये बेटा एक्टिव साइट एस्टाइल कोलिनेस्टरेज एंजाइम है बेटा, ये एक्टिव साइट पे इसको बाइंड करते हैं. ये क्या करते हैं बेटा, देखो बेटा, एस्टाइल कोलिन है, एस्टाइल कोलिन को एस्टाइल कोलिनेस्टरेज एंजाइम ब्रेक डाउन करता है. इट प्रिवेंट्स द एक्शन ऑफ द एस्टाइल कोलिन. ओपी पॉइजनिंग, it comes and binds to the active site of this acetylcholinesterase enzyme. Then it forms OP and acetylcholinesterase enzyme complex. So it prevents breakdown of acetylcholine because जो acetylcholine को break down करने का enzyme है वो already बंद हो चुका है, अब available नहीं है. Now pralidoxime, it then comes and binds to this complex. It then comes to binds to this and reactivates this enzyme and then breaks down the acetylcholine. How does it? At paradise reactive is acetylcholine enzyme already bounded to OP and reversing its inhibitor. Yes, already bounded. ये इस वाले पोर्शन को इफेक्ट करेगा बेटा. फिर से बोलूंगा बेटा क्या है, देखो ओपी आएगा, ओपी पॉइजनिंग ACHE के साथ बाइंड करेगा, ACH ये बनाएगा क्या, ओपी कॉम्प्लेक्स, ACHE कॉम्प्लेक्स. अब जो प्रालिडॉक्सिम है, प्रालिडॉक्सिम किससे बाइंड करेगा, क्या इससे करेगा, नहीं. क्या ये इससे करेगा, नहीं. ये बाइंड करता है, इट बाइंड्स टू द कॉम्प्लेक्स, इट बाइंड्स टू दिस कॉम्प्लेक्स व्हिच इज ऑलरेडी फॉर्म्ड. इट बाइंड्स ओनली दिस कॉम्प्लेक्स बेटा, ऑलरेडी फॉर्म्ड OP and acetylcholine and nesterase enzyme complex and it reactivates that enzyme. ठीक है बेटा, ठीक है. क्वेश्चन नंबर 88. Fawn undergoes a comprehensive geriatric assessment. She has a gait, देखो बेटा geriatric old age patient है, slow gait speed है बेटा, weak grip symptoms, exhaustion है, unintentional weight loss है, and the last 6 years laboratory सारे, जब सब कुछ नॉर्मल होता है, old patients everything is normal but there is an physiological weakness, gait problem, grip sickness, exhaustion, that is known as beta. This patient is known as this fetal, what is known as frailty syndrome beta. This is known as a frailty syndrome. This is known as a frailty syndrome beta. Why not a sarcopenia? Sarcopenia means muscle loss होना बेटा. It is in muscle loss, performance, सब कुछ है. Muscle loss, performance weak करना, muscle strength. It is based on the muscle. क्या उनमें जिसमें old जिसमें chronic illness patients में होती है बेटा. Normally geriatric patient old age में क्या नहीं बोलेंगे, जिनमें illness में कैंसर, inflammatory कुछ condition होगी, इसमें बाकी weakness आएंगे, तब हम बेटे इसको बोलेंगे क्या polymyalgia, rheumatia, it means a proximal muscle pain होगी बेटा. This फ्रेलिटी क्राइटेरिया में ना जो है बेटा, उसमें पेशेंट क्या होना चाहिए, ओल्ड एज पेशेंट है बेटा, अनइंटेंशनल वेट लॉस है उसका बेटा, एग्जॉक्शन है, स्लो वॉकिंग गेट स्पीड कम है, लो फिजिकल एक्टिविटी है, वीक ग्रिप है बेटा, ये सारे फ्रेलिटी सिंड्रोम्स है बेटा, याद रखना बेटा। क्राइटेरिया फ्रेलिटी सिंड्रोम्स क्या है बेटा, वेट लॉस है बेटा, अनइंटेंशनल वेट लॉस है बेटा, फिजिकल एक्टिविटी कम होना, डिक्रीज फिजिकल एक्टिविटी पेशेंट का, और ग्रिप ग्रिप स्ट्रेंथ बेटा, और गेट प्रॉब्लम है बेटा, गेट स्पीड कम होना। देखिए दादा, क्राइटेरिया मोस्टली वेट लॉस, अनइंटेंशनल वेट लॉस, अनइंटेंशनल वेट लॉस, स्लो गेट हो जाना, लो फिजिकल एक्टिविटी हो रहे हैं, ये बेटा ओल्ड एज में, इसको बोलते हैं फ्रेलिटी सिंड्रोम। A middle-aged man underwent a laparoscopic hernia intentionally seen sac containing the inguinal angulus from deep ring and neck is lateral to the inferior. बेटा लेटरली जो होगा उसको बोलेंगे हम इंटरनल एपिगैस्ट्रिक हर्निया। अगर आपने बेटा होगा पढ़ा होगा ट्रेंगल क्या होगा, हैसलबैक ट्रायंगल बेटा, अगर हम देखेंगे ये है मीडियल बाउंड्री इसकी बेटा, लेटरल बाउंड्री रेक्टस एब्डोमिनस होती है बेटा, अगर इसकी लेटरल बाउंड्री होंगी बेटा, लेटरल बाउंड्री बेटा इसकी इंफीरियर एपिगैस्ट्रिक आर्टरी और इंफीरियरली इसका इंगुइनल लिगामेंट होगा। अगर बेटा यहाँ से आएगा, यहाँ की लेटरल टू इट इंगुइनल हर्निया इनडायरेक्ट, अगर थ्रू दिस ट्रायंगल आएगा बेटा, दिस इनडायरेक्ट इंगुइनल हर्निया, इट शोज the neck lies lateral to the inferior gastric artery. Lateral means it is an indirect inguinal hernia. All of the following primary take place in mitochondria. Mitochondria एक्सेप्ट, बेटा कौन माइटोकॉन्ड्रिया में होता है, कौन साइटोप्लाज्म में होता है, टू पाथवेज होता है। तो साइटोप्लाज्म पाथवेज वो प्लेस होते हैं जो फेड स्टेट में होते हैं, जिसमें हम कुछ व्हेन वी आर फेड, व्हेन वी हैव ईटन समथिंग, दैट मीन इंसुलिन विल बी हाई एट दैट टाइम एंड एंजाइम्स व्हिच टेक पार्ट in fed state are usually active in the phosphorylated state. What are the pathways taken in cytoplasm? For example, every synthesis that occurs in the cytoplasm, for example, fatty acid synthesis, cholesterol synthesis, glycogen synthesis, except glycolysis. Every synthesis pathway takes place but every synthesis pathway takes place in cytoplasm except ketone body synthesis, except ketone body synthesis, बेटा याद रखना, except ketone body synthesis, except ketone body synthesis, except ketone body synthesis, rest all synthesis takes place in the cytoplasm. And in the metabolism, in the phosphate, the stages that occur in the mitochondria, every breakdown, yani glycogenolysis, glyco, this fatty acid oxidation, this at all, these takes place in the mitochondria, except glycolysis. Glycolysis takes place in the cytoplasm. याद रखना बेटा, सारी सिंथेसिस वाले किसमें, साइटोप्लाज्म में होता है, एक्सेप्ट दो चीजें, कीटोन बॉडी सिंथेसिस एंड कीटोन बॉडी सिंथेसिस एंड कीटोन बॉडी, एक्सेप्ट कीटोन बॉडी सिंथेसिस, याद रखना एक्सेप्ट कीटोन बॉडी सिंथेसिस। माइटोकॉन्ड्रिया में लिसिस वाले सारे एंड ऑक्सीडेशन वाले, एक्सेप्ट बेटा ग्लाइकोलाइसिस, एक्सेप्ट ग्लाइकोलाइसिस, ये साइटोप्लाज्म में होता है बेटा। These are the things, synthesis and glycolysis साइटोप्लाज्म में, यहाँ पे फैटी एसिड ऑक्सीजन, ग्लाइकोजेनोलाइसिस होगा, किटन बॉडी सिंथेसिस होगा, ग्लूकोनियोजेनेसिस माइटोकॉन्ड्रिया में बेटा। दीज आर द पाथवेज, ठीक है बेटा। कौन साइट्रिक एसिड केटोजेनेसिस बेटा, ऑक्सीडेशन ऑफ फैटी एसिड सिंथेसिस, फैटी एसिड सिंथेसिस विल बी डन, but it will be synthesis in cytoplasm. So this will be the answer. Okay. मैनेजमेंट ऑफ दिस पेशेंट क्या है बेटा, देखो his emergency room for trauma history recall that he has alert and response for a brief period in a locker before he became unconscious. Now GCS is 6 बेटा with anescoria, पल्स रेट इतना है, अब इसका GCS ड्रॉप होना बेटा, एक्स्ट्रा ड्यूरल हेमेटोमा, पेशेंट एक्स्ट्रा ड्यूरल हेमेटोमा है विद GCS लॉस, व्हाट विल बी द मैनेजमेंट ऑफ दिस पेशेंट बेटा, management of the extradural hematoma beta with sudden loss of GCR. Normally we use it to go for this what's known as a surgical evaluation of this patient because GCS loss है बेटा, GCS loss है बेटा, GCS loss है ठीक है बेटा, GCS loss है बेटा, ठीक है बेटा। What it, क्या क्या करेंगे बेटा, अगर जीसीएस पेशेंट्स का लॉस हुआ है, सडनली ड्रॉप हुआ लेस देन 90, पुपिलरी एबनॉर्मलिटीज है, तो हम इसको बेटा सर्जरी करेंगे। या अगर वॉल्यूम ग्रेटर देन 30 ml है पेशेंट को, अगर ग्रेटर देन 30 ml बेटा है, चाहे न्यूरोलॉजिकल से कुछ भी हो, नॉर्मल भी हो, रिगार्डलेस ऑफ, याद रखना, रिगार्डलेस ऑफ न्यूरोलॉजिकल सिम्टम्स, अगर ये नॉर्मल ओके भी होगा लेकिन वॉल्यूम 30 ml से ज्यादा है, देन वी आल्सो गो फॉर द क्रेनियोटोमी। Which of the following clinical findings would likely favor early detection of the glottic cancer in patient with suspect? देखो बेटा, हमें suspected laryngeal malignancy है, तो it is always a hoarseness of the voice। hoarseness जैसे ही थोड़ा बहुत hoarseness of voice हम examination करेंगे तो we will early detect the cancer। we will early detect the cancer है। Now there is an revealed the complete absence of valvular structure VVF। What is the most probable diagnosis? Complete absence, there are three types of VVF। Well, three one well-balanced diseases. There are three types: type 1, type 2, and type 3। Type 1 में there is a partial quantitative deficiency. Type 2 there is a qualitative। Type 2 is a qualitative। Type 3 is a complete quantitative deficiency। याद रखना बेटा, type 1 partial quantitative, type 2 is an only qualitative, it is a partial, type 3 is an complete deficiency। So there is a complete absence, so type 3 will be the answer। type 2 is a qualitative, remember this, type 2 is a qualitative। ठीक है बेटा, your intern presence in this department you came across ABG report following likely causes। देखो बेटा, 7.5 कार्बन डाइऑक्साइड कम है, तो बाइकार्बोनेट इज नॉर्मल, बाइकार्बोनेट नॉर्मल, कार्बन डाइऑक्साइड कम होना। कार्बन डाइऑक्साइड नॉर्मली कितना होता है बेटा, नॉर्मली कार्बन डाइऑक्साइड कितना होता है, 35 to 40 होता है बेटा, 45 में। ये नॉर्मल कार्बन डाइऑक्साइड कम होना है तो क्या होगा, ब्रोंकियल अस्थमा में क्या होता है, ऑक्सीजन। ठीक है बेटा, ब्रोंकियल अस्थमा में क्या होगा बेटा, क्या ब्रोंकियल अस्थमा में कुछ होगा, ठीक है बेटा, ब्रोंकियल अस्थमा में क्या होगा, देयर विल बी इनएडिक्वेट वेंटिलेशन, वेंटिलेट नहीं होगा, जब वेंटिलेट प्रॉब्लम नहीं होगा तो CO2 बढ़ेगा, रेनाटिब्री एसिडोसिस है। वोमिटिंग में क्या होगा, वोमिटिंग में मेटाबॉलिक अल्कोलोसिस होगा, लेकिन यहाँ पे क्या है, इट इज अ रेस्पिरेटरी अल्कोलोसिस, गिवन इज अ रेस्पिरेटरी, वोमिटिंग में मेटाबॉलिक अल्कोलोसिस होगा। सो ओनली अटैक देयर इज एन पैनिक अटैक, इसमें इंक्रीज वेंटिलेशन होगी तो पेशेंट को अल्कोलोसिस होगा। अगेन रिपीटिंग, ब्रोंकियल अस्थमा में पेशेंट, ब्रोंकियल अस्थमा में पेशेंट्स बेटा वेंटिलेट नहीं कर पा रहा है, प्रॉपरली सांस नहीं, जब प्रॉपरली सांस नहीं ले पा रहा है तो कार्बन डाइऑक्साइड बाहर नहीं जा रहा है, वो अंदर ही रह रहा है, तो कार्बन डाइऑक्साइड बढ़ेगा, अंदर बढ़ेगा तो एसिडोसिस होगा पेशेंट्स को, रेनल ट्यूबुलर एसिडोसिस है। पैनिक अटैक में क्या, सांस जल्दी लेगा, सांस जल्दी लेगा, सांस जल्दी लेगा, कार्बन डाइऑक्साइड बाहर फेंकेगा, बाहर फेंकेगा तो क्या होगा, क्या होगा, अल्कलोसिस होगा, रेस्पिरेटरी अल्कलोसिस होगा इस पेशेंट को। सेम यहाँ पे ऐसे पेशेंट के पास अल्कलोसिस है, कौन सा वाला है, रेस्पिरेटरी अल्कलोसिस है। 95 बेटा, 95 बेटा, पेशेंट सडन ऑनसेट पेन इन द राइट हेमिस्फीयर स्क्रोटम फोर्थ, या किसी के लिए नो ट्रॉमा, ट्रॉमा तो कुछ नहीं है, विच ऑफ वन रहेगा, टेस्टिकुलर टॉर्शन और टॉर्शन कौन फेवर का, फेवर इन शॉर्ट ड्यूरेशन, फेवर इन शॉर्ट ड्यूरेशन बेटा, इट कैन बी एपिडेमाइकाइटिस बेटा, hemisecrotal and secrotal edema, it can be seen both। ल्यूकोसाइटोसिस विद सीवियर पेन, ल्यूकोसाइटोसिस मोस्टली एपिडाइडिटिस में होता है, सीवियर पेन दोनों में। एब्सेंट क्रेमेस्टिक रिफ्लेक्स, एब्सेंट रिफ्लेक्स होना है बेटा, ये फेवर करेगा, इट फेवर्स फ्रॉम टॉर्शन, एब्सेंट रिफ्लेक्स। नाउ Schimmer's test was performed on a woman with present chronic irritation dryness in the both। Was whether the correct incorrect, but incorrect कौन है, Schimmer's test, the strip is placed, हाँ बेटा ये ऐसे स्ट्रिप होती है, ये प्लेस की जाती है आइज में, ठीक है बेटा, स्ट्रिप एक प्लेस की जाती है बिटवीन मीडियल 2/3 एंड लेटरल 1/3, सही है। द स्ट्रिप इज रिमूव्ड आफ्टर 5 मिनट, ये भी सही है। स्ट्रिप वेटिंग ऑफ लेजन इज इंडेक्स एंड यस बेटा, क्योंकि ये बेटा स्ट्रिप ऐसी होती है, पेपर जैसी होती है, ये वेट होती है, और फिर इस वेट को हम मेजर करते हैं कितना एमएम होती है। टीयर फिल्म ब्रेकअप टाइम ऑफ लेस देन 13, टीयर फिल्म ब्रेकअप टाइम है स्लिट लम एग्जामिनेशन में होता है बेटा, इट इज नॉट सीन इन दिस पेपर, ये पेपर वाले पे नहीं होता है बेटा, इट इज सीन इन एग्जामिनेशन, स्लिट लम एग्जामिनेशन, नॉट ऑन दिस पेपर, सो दिस विल बी द आंसर। ओ और rods, हाँ ठीक है बेटा. A man presents with tenderness, bony ache, bruising of his legs, bone marrow aspirates, shows the presence of the characteristic cells. Characteristic cells. Which are the following abnormalities? Which are the following abnormalities, बेटा? Is seen in this, बेटा. अगर बेटा आप देखोगे, these are there are seen in multiple or rods. Multiple or rods are seen in this. कहाँ पे होता है? This is an a acute a acute promyelocytic leukemia, यानी AML M3 में होता है बेटा. AML M3 में बेटा acute promyelocytic leukemia, and in AML M3 there is a translocation of the 15 16 15 15 inversion 16 बेटा. Inversion 16 is seen in the AML M4 बेटा. Inversion 3 is seen in AML M7 बेटा, and translocation 8 to AML M2 बेटा is seen. 50-year-old maid has enjoyed playing tennis in childhood. However, she recently, while playing his son, he developed dizziness and vertical leg stiffness, along with cropping his left arm, has repeatedly serving the ball with the racket in his left hand, which large vessel is likely stenosis in this patient. देखो बेटा, patients का scenario, patient develops cramping, dizziness, vertical action and repetitive movement. Left arm से movement करने के लिए उसको ये चीज, that means there is something which compresses the left hand, compresses this left blood supply. This is the characteristic of this subclavian steal syndrome. In subclavian steal syndrome, बेटा ये मैंने नाम रखा है. This is a stenosis of the first part of the left subclavian artery, stenosis proximal to the vertebral artery. And this is the beta, जब भी लेफ्ट साइड काम ज्यादा करेगा, देन इट काम करते रहेगा, यूटिलाइज ज्यादा करेगा, देन इट फेसेस दीज काइंड ऑफ सिम्टम्स. The stenosis, because there is an increased demand. When workload increases, there is an increasing demand of blood supply. Because of stenosis, the blood flow नहीं जा पा रहा है. There occurs a collateral development, and because of that, these symptoms occurs. ठीक है बेटा. one more question. ठीक है. A researcher investigating the relationship between systolic blood pressure and body mass index in a sample of 300. Systolic blood pressure और body mass index की relation करने हैं. Both variables are measured on a continuous cycle. Which graphical method most appropriate for visualizing this relationship? बेटा both variables, if you see both the variables are the quantitative variables and quantitative variables. ठीक है बेटा. Both variables, systolic blood pressure and mass index, these are the quantitative variable, and the quantitative variables can be used on this scatter plotter. ठीक है बेटा. Histogram बेटा, it usually distribute a single continuous variable बेटा. ठीक है बेटा. इसमें हम बेटा single continuous data यूज करते हैं बेटा. ठीक है बेटा. बार में हम बेटा फ्रीक्वेंसीज को कंपेयर करते हैं. बार में हम सीक्वेंसीज को कंपेयर करते हैं बेटा. ठीक है बेटा. Two quantitative variables can be seen on the scatter plotter. ठीक है. And what about this? I'm again repeating this beta. Histogram में beta single continuous data. Single continuous data is used. Here we will see the relationship between two quantitative variables. Two quantitative variables. And here when there are two quantitative variables, so we will use a scatter plot. We will use a scatter plot. ठीक है बेटा. हिस्टोग्राम में बेटा क्या है? सिंगल कंटिन्यूअस डेटा यूज किया जाता है. ठीक है बेटा. एंड बार डायग्राम फ्रीक्वेंसीज यूज की जाती है. बार डायग्राम में बेटा फ्रीक्वेंसीज यूज की जाती है बड़ी. ठीक है बेटा. एंड व्हाट अबाउट दिस पाई चार्ट? पाई चार्ट बेटा इट हैज categorically represent portions of the data बेटा. proportions of data. अगर क्वेश्चन होता है proportion of data यूज किया जाएगा. proportion of data. For example, ऐसे दिया जाएगा, then it will be saying that ये 9% है, ये 10% है, ये 20% है, ये 70%. It will be a pie chart. In a proportion of the data will be given. What about the bar charts, बेटा? I told you that बार चार्ट में क्या होगा बेटा? There will be a qualitative data. There will be a. I'm repeating the question number 19. Not by question number 99. Repeating again. देखो बेटा, relation between the systolic blood pressure and a body mass index. These both are beta quantitative data. These both are the quantitative data. Sample of 300. Both variables are measured on a continuous scale, quantitative and a continuous scale. Quantitative and a continuous scale. Now we will see which among the following shows us quantitative and a continuous data. ठीक है, quantitative and a continuous देखा. ठीक है. Take out the histogram. It shows us the quantitative data, but of only one variable, single variable. यहाँ पे दो variables थे बेटा. Systolic blood pressure is one variable, BMI is two variable. It is a quantitative, yes. Histogram quantitative है, लेकिन it shows only one variable. It shows only one variable. The bar diagram, it is a qualitative. It is a qualitative, not a quantitative diagram. ठीक है बेटा? Not a quantitative diagram. देखो बेटा, ये देखो. These are this is an histogram and this is a bar graph. There you will see they are separated by some space. Here you will see they are continuous data, and you will see they are not continuous, they are qualitative, this is quantitative. And the scatter plotter, it is more than two variables manual, and the pie chart, it shows a pictorial representation of proportional data. It is a proportional data. 10%, 50%, 20%, 10%. When this time proportion of the data is used, then it shows it is used in a pie chart. Last, according to the Matthews and Nash class, which of the following muscle is an flap that can survive on minor pedicles alone? That can survive on minor pedicles alone, beta. Lattice dorsa is a type 5 flaps that can survive beta on minor pedicles alone. That can survive on the minor pedicles alone. Because in type 5 dominant pedicle, there are minor segments, small flaps that flap can survive on these minor flaps alone. These are the classification. In type 1 beta, there is only one dominant flap. In 2, there are type 2, there is one dominant flap and minor flaps, one or two minor pedicles. In type 3, there are two dominant. This is a dominant, this is a minor, this is a dominant, this is a dominant. In this type 4, there is a flap with multi-segmental beta, with multi-segments. These are multi-segments. And in this, these are only multiple minute flaps, and this flap survives on these minor segments, minor pedicles. And lattice dorsi is an example of this, and this is a classification of this. And this completes this first 100 question of set 1, and we will explain you set 2 in the coming days. I hope you like it, and please comment what you find any difficulty. If you want me to repeat any question among these 100 questions, I will try my best to repeat that question. Thank you so much, guys.